ASEM Forum on Human Rights of Older Persons, Present and Future. Well, good morning, good afternoon, and good evening. Welcome to the day 2 of the forum with me, Shin Ji-ye, as your MC. Well, the day 2 of the program is of course being live streamed through the YouTube channel once again in order to open our doors worldwide. So my special thanks goes to all the participants joining us from all around the globe. Well, make sure that you stay with us until the very end of the forum as we will be discussing the variety of issues related to the human rights of older persons. And now, to begin with, let us first watch a video clip that touches upon the overarching theme. Let us watch it through the screen. Yes, ladies and gentlemen, you have just watched a video clip that touches upon our overarching theme. Moving on, inviting the ASEM partners, national and international experts from academia and organizations, let us now begin session number 2 under the title Older Persons in Humanitarian Crises. On stage, we have Executive Director Lee Sung-hoon, who will be joining us as the moderator, and Director Jang Eun-ha as the speaker. And now let me pass on the microphone to our moderator, Executive Director Lee Sung-hoon, to lead the session. Sir, please.
Good morning, good afternoon, good evening, wherever you may be in the world. My name is, Korean name is Sung-hoon Lee, but English I have a English name, Anselmo Lee. You can call me Anselmo. I'm very happy to be here today as a moderator of session 2. Session 2, as you know, topic is older persons and humanitarian crisis. I believe you enjoy the yesterday session opening and the session 1, which is a health crisis related to COVID-19. And this is the second one. As we know, this afternoon, we are going to have a third thematic session, the older persons in climate. So we have a 2H, 1C, health, humanitarian, and climate. So on this topic, we have invited 4 distinguished experts on the issues of the humanitarian crisis from different perspectives. Let me introduce one by one. So they have a 20 minutes presentation, and then we'll open the floor for Q&A and also hopefully interactive dialogue among the 4 speakers and also some participants. This session is very meaningful for me because I'm approaching the age of older persons. And so I'm getting more interested in the topic of the human rights of older persons. And every day I live with my mom, who is 90 years old. So this is a day-to-day reality for me, you know. And also, I was an active member of the civil society group on ASEM. So this is a global aging center, which was born several years ago. But as you know, ASEM was born 1996 in Bangkok. That time, there was no civil society consultation process. But it was only 1998 in London, the second ASEM summit. I was in London. And then, as you may remember, year 2000, ASEM summit took place in Seoul, South Korea. 2000. I was a member of steering committee at that time. You know, since then, I've been engaging this ASEM civil society process. So I'm very happy to be part of this ASEM process, particularly on the topic of the human rights of older persons, which is becoming more and more important and relevant in today's world, particularly in Korea and Asia elsewhere. So let me introduce first speaker. As we see in the program, the Matthew Wells from Amnesty International. He's a deputy director in the Crisis Response Program at Amnesty International. He has authored many of the books and also a lot of the practical experience on the grounds. So Matthew Wells, are you online? So good morning, good afternoon. Are you in London now? Where are you now?
I'm in Washington, D.C.
Washington, D.C. It must be evening.
Yes, that's
okay,
right.
So good evening once again. Okay, so welcome. So you have about 20 minutes for your presentation. Okay, over to you.
Thank you very much. I'm going to share my screen as I have a PowerPoint to guide my talk. Is it coming through now? Can you see my screen, the PowerPoint?
Okay, please go ahead.
Perfect. Great. So, traditionally when talking about humanitarian crises, the focus is often on what happens after displacement, on the particular challenges that people face when living in an IDP camp or a refugee camp, for example, or even with host families. And I'm going to talk a bit about this today, but I actually want to start with the experience of conflict itself, which is what a lot of my work focuses on, the specific ways that armed conflict affects different parts of a population, including older people. And it's often at this moment of conflict itself that we see the first point of extreme risk for older women and older men in humanitarian crises. And often a quite high risk that I think is often not recognized, particularly related to older people. And the specific experience that older people have in conflict situations is then key to understanding the humanitarian challenges and risks that they then face in displacement afterwards often. So I'm going to start with a few specific examples. I've done a lot of work, for example, on the conflicts in Myanmar and the Rohingya crisis in particular. And what hopefully you can see now on the screen in front of me is a mortality survey that was done in relation to the Rohingya crisis by Doctors Without Borders. And if you look in particular at the mid level from 25 August to the 24th of September, that was the period of the Myanmar military's operations in 2017 against the Rohingya population. And in particular, if you look at the middle column, deaths per 10,000 per day, what we can see is that those who were 50 years and older died at enormously disproportionately high rates compared to other parts of the population, 3+ times the rate as other parts of the population. And overwhelmingly during this period, what we're talking about is violent deaths, deaths from a direct result of the military's operations. And I think quite often we perceive that older people are less at risk in a situation of conflict, that they receive some sort of protection because of their older age or status. In reality, what we see in places like Myanmar, and this comes up in a number of other contexts that I've worked, that older people are actually disproportionately at risk of being killed during the immediate conflict period. And a second slide, which shows similarly, and again, if you look at that period in the middle of 25 August to 24 September, the key stat is the weighted proportion, which is here is the estimate of the percentage of the older population, or all of these different parts of the population, who died during this one period. And it's over 5% of those who were 50 and older who, based on this quantitative study, are believed to have died as a result of the Myanmar military operations during that period. And again, it's enormously disproportionate compared to children and those of later childhood and adult age that we normally, I think, often perceive as actually being at greater risk than older people. But in reality here, and again, in many other places that I've worked, the stats actually bear out a very different reality. And I know there's a panel later today on environmental disasters, climate change disasters, so I won't touch on this in detail, but just to say that there's an enormous body of literature that shows similarly that older people face disproportionately high risks for a wide variety of other types of crises, humanitarian otherwise, including things like the Ebola outbreak, tsunamis, earthquakes, wildfires, flooding. So again and again, I think we need to challenge our assumptions around the experience of older people in situations of conflict. And one key thing here is that we need to understand that the experience of older people is not homogeneous, and the decisions that they make in situations of conflict are likewise not homogeneous. I think oftentimes there is an assumption or a belief that some older people are at risk because of intersections with disability, because they have reduced mobility and are unable to flee, for example, when a humanitarian crisis or a conflict takes place. And that's certainly the case, but for many older people. But for many others, there's actually a very different reasons why they often find themselves in particular risk in the first place. In many people that I've interviewed, older people are often chosen to stay behind because they're seen as less at risk, and so they're tasked with protecting cattle and farmland and other property of a community. Oftentimes, older people have disproportionately strong ties to home and to land. They've lived in a particular village for 50, 60, 70 years, and so are more likely to choose to stay behind in a village when a conflict or some other sort of humanitarian crisis takes place than other parts of the population. And what hopefully you can see in the picture here is an older man whom I interviewed in Myanmar who had stayed behind with several other older men to look after the village's cattle. He had a hearing impairment, and when fighting took place near the village, he didn't hear the fighting, and so stayed at home and didn't leave when other people left. And then when the military came in and found him and only one other person still in the village, he was tied up to a tree. What you see on his wrist are scars from where he'd been tied against the tree and beaten. And it relates to the fact that older people often have very specific risks in the situation of conflict and humanitarian crises. In Northeast Nigeria, where I have done a lot of work, again, older people often have lived in a place for decades. They've provided for themselves through farmland for decades. And so the idea of being displaced at a moment of a conflict is a very difficult one, and one often that they choose to stay behind because they know that they can maintain their livelihood there in a way that will be much more difficult in an IDP or a refugee camp. One other issue that we have focused on a lot in my recent work is also the specific risks related to detention that older people face in situations of conflict. In Northeast Nigeria, for example, there have been hundreds, if not thousands, of older men in particular, and some older women who have been detained in the context of the conflict. And in that detention, they have faced horrific conditions that include extreme overcrowding, extreme heat, little water, little food. And these pose, of course, particular risks to older people. And so as we see here, and I'll read it out, a quote from a 69-year-old man whom I'd interviewed in Northeast Nigeria who'd been detained by the military for 2 years. He said, quote, "So many older people died. They couldn't resist hunger. They couldn't resist all those things. Sometimes we'd see someone collapsed and we'd put some water on them to see if the person died. When it was dry and hot, people were dying too much. There's no consideration for older detainees." And again, I think we very rarely think about older people in the context of military detention in situations of conflict, but it's a reality in many of the places where I have worked. Another issue I want to touch on is the specific relation of older people and often the trauma that they face in humanitarian crises. Again, given these deep ties to home and lands, there's often a particular trauma or psychosocial harm linked to the separation from home and land. Oftentimes, older people whom I've interviewed have been displaced not once, but twice, 3, 4, 5 times over the course of their lives from different iterations of a conflict or humanitarian crisis. Amongst the Rohingya I interviewed, for example, more than 70% of the older Rohingya I spoke with had been displaced multiple times in the course of their life. And that repeated displacement then has a particular psychosocial impact, a particular effect on both physical and mental health. And the other thing that older people often face in situations of conflict is that not only do they experience violence directly themselves, but they're often witnesses to crimes committed against their children or grandchildren. And the amount of harm that inflicts and what that means, again, from a psychosocial perspective, is really unique for an older population in particular. And many times they then end up as primary caregivers to grandchildren because an adult son or adult children may be detained or killed in the course of conflict, and then they have to take over the role of being a primary caregiver. And these, again, often then aren't realized in humanitarian situations. And again, I want to share quotes from a woman I interviewed in northern Myanmar who was 62 and had been displaced 4 times in her life as a result of conflict. And what she said, quote, is, "We had to start all over again and again. We had to borrow some money from the locals in each place we fled to. When we built up our lives, then we fled again. When I think about it, I want to cry." And it's this key thing that for older people, we need to recognize that there are often particular risks and particular forms of harm that are often compounded over a long period in which they have faced multiple iterations of a crisis, not just often, this being whatever the current crisis is often not the first one. So in terms of the experience of conflict itself, before I turn to some of the humanitarian response issues, some of the key takeaways from our work is that there needs to be far better planning done that takes into account the specific risks and needs of older people. That older people, while again not homogenous in any ways, but are often making different choices from other parts of the population. Their lived experience is different. Their preferences are different in terms of, again, where wanting to stay in a village, for example. And so we need to better understand first by listening to older people themselves, and then to design response that's rooted in their specific experience and their specific needs. So it starts with engaging and listening. And the second key thing here is that, when humanitarian access restrictions, which are very common throughout the world, including in places like Myanmar and Northeast Nigeria, means often that a humanitarian response is based on centralized points, an IDP camp or a refugee camp, and assistance getting there. But when many older people are making different decisions and in fact choosing to stay behind in a village, getting humanitarian assistance to a centralized site is not good enough. It's not getting it to where many older people still are. And so there's a need then to push back much harder on humanitarian restrictions. When we allow governments to restrict the free flow of aid, that often has a disproportionate impact on older people because it's not reaching the places that they are most likely to be. And again, around psychosocial care and recognizing the particular harms, particular forms of trauma that older people are most likely to face, and the fact that this is often not recognized when building physical and mental health responses in situations of crisis. So in terms then of moving to the humanitarian response itself, oftentimes when I've gone into refugee or IDP camp settings, I hear things like older people are only 3 to 4% of the displaced population. I heard that repeatedly in Bangladesh in the refugee camps. Only 3 to 4% in this case meant more than 35,000 older women and men. We're often casting aside very large parts of a population because they're seen as smaller in terms of the percentage of the overall displaced population. In Northeast Nigeria, likewise, it was 7+% or 60 and older, which is more than 125,000 older women and men who were displaced internally in Northeast Nigeria. And again, what we see is that the most basic of rights are being neglected of older people in situations of humanitarian crises. From sanitation to health, to food and water, to the most basic right to participate and to be included in consultation, that these are systematically often being disregarded in humanitarian crises. And so much of this comes back to the initial collection of data and the design of humanitarian programs. And if it's not gotten right at the first stage in terms of including older people in interviews and response, that then everything that comes after is doomed to fail. I want to show a couple quick pictures of the refugee camps in Bangladesh, and you can see just how hilly the terrain is, and often then how particularly challenging that is for older people, particularly older people with reduced mobility, to navigate. Here's one, for example, of a shelter where I interviewed an older man and an older woman, and you can see just how steep the incline and decline is going in and out of the shelter. There's nothing to hold on to, no railing, no nothing. And the older man and older woman who lived inside there had little to no ability to leave the shelter to get to a food distribution point or a health clinic, or even to go to a toilet that was several hundred meters away. And so they ended up basically confined to the shelter because of the poor planning and design of the humanitarian response. And this ultimately goes to a core issue of just basic dignity, that by a failed humanitarian response or humanitarian response that doesn't adequately include older people, we are denying the most basic of dignity. And this is an older man that I interviewed again in the refugee camps in Bangladesh, who was in his early 90s. And the quote here is one that has stuck with me and will always stick with me. He said, quote, "I go to the latrine here, I eat and sleep here. I have become like a cow or goat. What more can I say? Cows defecate and urinate in the same place where they eat. Now I'm sleeping in a latrine." And this is because of the way that it was designed. You can see in the background again, how difficult the incline and the lack of space and the lack of rails or anything meant that his entire life was essentially confined to a shelter. And what that means, again, in the access to the most basic of rights. A core issue here, and I'm sure this will come up again and again in what the other panelists will say, but it's around the exclusion of older people from beginning to end in the planning of humanitarian response. it is, more frankly, it's discrimination and the lack of seeking out older people's views to better understand their needs and how to respond to these crises. And again, a quote here from an older woman in Northeast Nigeria who has a spinal condition that meant that she was largely confined to her shelter. And she said, quote, "I'm an older woman, no one cares about me. I can't go there to the distribution and they won't come to me. No one is paying attention to us. No NGO has come and asked about my situation." And it's something that I hear again and again in my interviews in different places where we've done work, is that oftentimes the older people that we're interviewing have never before been interviewed or spoken with in terms of understanding their specific needs and then how to guide a humanitarian response. And how could you ever, again, build what's needed in terms of meeting their specific rights and needs if you've never listened to them in the first place in order to understand in the programming. And there's a number of ways that this comes through, but the last one that I want to focus on quickly before concluding is specifically around access to health services in humanitarian crises. And this is something that I've seen similarities across conflicts, across crises, where chronic conditions are very rarely part of a humanitarian response. Whether it's high blood pressure, diabetes, chronic lung conditions, that there's very rarely any sort of medication or otherwise an inclusion of these issues when developing a humanitarian response. And the result, as you can see from the quotes here from another Rohingya refugee in Bangladesh, is that very often they then have to sell part of their food, part of their, their ration in terms of blankets and other goods. They're having to pick and choose among their most basic rights, giving up on food, which is already limited, in order to be able to get essential medication because it's not provided for in a humanitarian response. And a very, again, similar quote from Northeast Nigeria, where she says, "If we go to the clinic in the camp, it's just drugs for emergencies, malaria and things like that. For what we need, we have to go to the hospital and pay for it. When they refer us to the hospital, we don't have money, so we just stay at home. So many of my friends, other older people, have died because of this." And while I focused on health here, this is similar across the board. If we're talking about food, often it's designed in a way that's not accessible for older people or not meeting the specific dietary needs of older people. When it comes to sanitation, access to latrines, in places where HelpAge operates, I've seen incredible construction of latrines that are accessible, but all too often, that's not being mainstreamed across the entire humanitarian response, which means that latrines are not accessible to older people. These things have to become systematic in the way that we're designing humanitarian response. And so to conclude, some final takeaways in terms of the humanitarian response to crises like these. Number one, above all else, is the need for much better inclusion in the collection of data and then in the disaggregation of data that's used to really design all aspects of response after. If older people are invisible at this first stage when data collection is being done, it undermines everything that comes after it in the humanitarian response. A second is the need for training and preparedness to recognize and to respond to the specific risks that are associated with older age and to meet the specific rights and needs of older people. And that a lot of the problems in humanitarian response are linked to problematic assumptions about older people. There's often an assumption that older people will be cared for by others, by their adult children, by their grandchildren. The reality is, in many humanitarian crises, there are large numbers of older people who are living alone. There are large numbers of older people who are acting as primary caregivers for others. And even when they do have adult children nearby, they're not always taken care of by those older children. It puts them in a position of dependence when we have this assumption of being cared for. And we need to move away from that idea into one that is rooted in the individual rights of each and every person and responding to that, again, with the specific rights and needs of older people being met. And lastly, that just a center-based response, something that is rooted in the idea that you have to get to a centralized distribution point or health clinic, it fails to meet the needs of many older people. And that too often that is how humanitarian response is done. And there's a far greater need to recognize the individual risks that each person faces and to respond to those, whether that's through mobile teams that are going shelter to shelter or otherwise to meet specific needs. And to conclude, just to say that, I think what's happened over the last 18 months and the pandemic and the horrifically disproportionate impact that it's had on older people, if there is any silver lining, it's that it has shined a spotlight on something that has been ignored for far too long, and that is the disproportionate impact of older people with many of these things and the discrimination that they face. And so I think this is a hugely important moment coming out of the pandemic, hopefully, to recognize that discrimination and to begin to build systems that respond to the specific needs of older people. I'll stop there. Thank you very much.
Thank you very much, Matthew Wells. I think you paved the way for our further discussion because you brought us to ground reality, particularly Rohingya camps in Myanmar and the border also Bangladesh and also North Nigeria. We are going to discuss more the following presentation, more normative analysis and policy analysis. I think but your presentation is so important because we always have to remember the ground reality. That's a starting point, So it was so contrast listening to your presentation, see the pictures, the images of ground reality while we are sitting in the nice hotel, This is a reality today, So thank you for reminding us of the reality on the ground once again. And also some of the takeaways. I think a lot of information contained in your presentation. Let me highlight, two types of takeaways. First part was humanitarian crisis on the ground, and the second was humanitarian response. So I want to pay attention, especially the planning, the better planning and a life cycle contextual analysis and special attention to land and psychological care and so on. I think these are the very, very important the lesson learned from your presentation, which is a result of decade-long practice on the ground. And this can be linked to the next presentation. And I will give you some questions later on after listening to all the presentation, particularly as a practitioner, how do you respond to the presentation on normative and also the policy analysis of the situation of human rights of older persons? So let's go to the second presentation. Dr. Ken Bluestone is the head of policy and influencing the Age International, which is a very well-known international NGO on the human rights of older persons. Good evening, good morning. Where are you? Are you based in London now?
I am. Yes, I'm in the UK, right?
It must be early morning, right?
It is indeed.
I hope you are okay.
Really good to be here.
Thank you for joining us once again, in spite of a difficult time zone. Okay, so you have about 20 minutes to present the report, which can be also very interesting for the older audience. Please go ahead with the 20 minutes. Over to you.
Thank you very much. So can I just check that you can see the first slide? Yes? Okay, great. So look, I'd just like to begin by thanking you, the organizers, for creating this forum and for allowing us to share our experience in this panel. Age International, as you said, is the UK member of the Help Age Global Network, and together with Help Age, we carried out an analysis of how older people's rights were upheld in humanitarian crises and whether their needs were being met. This research was done before the coronavirus pandemic struck, but its findings are just as relevant today. And indeed, I think we're going to see a lot of similar themes emerging from the presentation that Matthew has just given. We undertook this research and produced the report because, as this ASEM forum is showing us, both the number and scale of humanitarian crises is growing, but also the proportion of older people being put at risk is growing as well. Crucially, the report is necessary and the research is necessary because older people continue to be let down by the humanitarian system that is supposed to meet the needs of all those at risk. Despite multiple international promises and commitments, the rights of older people in these contexts still aren't being taken into account sufficiently. There are various international commitments to protecting the rights of those most marginalized groups in times of humanitarian need, including older people. The Sustainable Development Goals commitment to leave no one behind. In 2015, the Sendai Framework for Disaster Risk Reduction was also agreed. In 2016, the World Humanitarian Summit, and which included as part of that an inclusion charter that was signed by more than 40 humanitarian organizations, including government donor agencies and leading humanitarian providers. And various acknowledgements have happened in the UN General Assembly and the Human Rights Council that need to do more to protect older people and other marginalized groups. But despite all of these good intentions, the humanitarian system is still not doing its job to protect and help those older people who are at risk. Even now, even when the coronavirus pandemic was emerging, and where all scientific evidence pointed to older people being at highest risk of serious illness and death, the first UN Global Humanitarian Action Plan did not include older people as one of the groups most affected and at risk from COVID-19. So it's clear that the humanitarian system must and needs to do more. We carried out our research. The report draws on findings from needs assessments that were carried out by HelpAge International in 11 countries across Africa, Asia, Latin America, and the Middle East. And in total, we interviewed, as you can see, over 8,800 people between the ages of 50 and over the age of 80. And these were people who have been affected by various humanitarian crises, natural disasters, conflict, or even socioeconomic crises. So what did we find? In brief, despite the excellent work that is taking place across the world to tackle a multitude of humanitarian crises, despite the commitment of humanitarian actors to the fundamental principles of humanity, neutrality, impartiality, and operational independence, older people's basic needs are not being met. In the research we undertook, we found that 64% of the people we interviewed didn't have enough to eat, 77% had no income, 20% had no access to shelter, 25% had no access to safe drinking water, and 62% had no access to bathing facilities. These figures point to a humanitarian crisis. But it's important to recognize that as well, that this is not gender neutral, and that older women are actually more affected by these issues than older men. And we must really take that gender analysis into the work that we're doing and think carefully about how do we ensure that older women and men's needs are accounted for. But as Matt has already pointed to, the issue of data collection and analysis is absolutely crucial. And underpinning the lack of meeting these basic needs of older people in this context was a failure of the humanitarian system to consult with older people and to gather data on their situation. Of the older people we interviewed, 77% had not been asked by any other humanitarian agency about the services provided to them. And 69% did not know how to make a complaint or provide feedback. So that accountability loop was completely absent. And in terms of the UN system, the humanitarian system's responses and their plans, 3 out of 11 of the needs overviews and response plans in the settings where we did our research, only 3 out of 11 included data on older people. At the heart of a human rights-based approach to humanitarian action is recognizing the people who are affected, recognizing their inherent humanity, and allowing them the dignity to have their own experience to be understood. sadly, this is where humanitarian response is often at its weakest. Even now, new research that is being prepared by HelpAge but is not yet released will show that despite there being guidance to disaggregate data by age and to include older people in the UN's humanitarian response, this simply isn't happening in practice in humanitarian needs overviews at country level. This is due in part to the chronic weakness in data systems, but it's also about the enormous pressure that humanitarian actors are facing to prioritize in the context of declining resources. This can result in focusing on populations that are larger in number or more visible. And sadly, older people may not be seen as warranting the extra time and cost for data collection and analysis. But as Matt pointed out in his intervention, that even though the proportion of older people as part of the overall population may not be as larger as some groups, we are talking about thousands and thousands of people whose lives are daily put at great risk and whose responsibility it is the humanitarian actors in general is to make sure that they get their rights are being upheld as well. With a lack of sufficient data, humanitarian actors and decision makers often have to rely on assumptions, and these assumptions may not be accurate. While we may like to think that in times of emergency, older people can rely on their families, and this again is pointing to comments that Matt has made, our research showed that many older people living that we interviewed were living alone, so did not actually have that support, family support. And again, older people that we interviewed also spoke that the actual system, humanitarian responses itself, were increasing their dependence on others, undermining their own human right to autonomy and independence. And they expressed concern about this. But most pernicious of all is an underlying ageist attitude that perhaps colors many of the decisions that are affecting older people and the way that the humanitarian system is responding. And that is to say that older people are assuming that older people do not contribute to their families and communities. They are assuming that they are solely dependent and do not have agency. It's our experience of working with older people in even the poorest and most difficult situations across the globe that this could not be further from the truth. And this is typified by the example of Cholpur, a 63-year-old refugee from South Sudan. Despite having to flee South Sudan to Ethiopia in 2016 with her 5 children after her husband was brutally killed, she has been elected leader of the Older People's Association in the camp where she lives. And Cholpur's story shows us that what it shows us is that older people, even in the most difficult context of refugee camps, can self-organize, can take responsibilities for themselves and advocate for others. Older people are not passive. These are people, there's a huge diversity, of course, to the experience of being older. And sometimes, and we are often dealing with situations of people who are living in extreme contexts and living with disabilities that does put them at greater risk and does require them to have greater support from others. But even when they are at risk, we shouldn't assume that they are passive, independent people who are a burden to society. Chol explains that though there are a lot of remaining tasks, I see a glimmer of hope, and I see older refugees' lives being rebuilt. And she really captures this sense of older people taking responsibility and trying to improve the lives of their community and as well as themselves. But coming back to how the humanitarian response is supporting older people in these situations, unfortunately, the lack of specificity, not taking specific needs of older people into account means that blanket approaches to humanitarian response are put in place. And in those contexts, the well-being of older people is truly suffering. Of the people we interviewed, 98% had at least one health condition, and Matt pointed to the importance of recognizing chronic health conditions in the health side of humanitarian response, non-communicable diseases. And half of those that we interviewed said that there was no medicine available for the conditions that they were suffering from, and that health services were too expensive. It's also important to recognize that the intersection of age and disability is acute in later life, with 40% of older people having at least one disability, and that this has a direct impact on the ability of older people to access help even when it is available, to get assistance from distribution points. 39% of the people overall of all age groups, 50 and over, were unable to reach distribution points independently. But when you disaggregate this by age, you look at the situation of older people aged 80 and over, and 70% of those people were unable to reach these distribution points independently. Since this report and research was published, we are still struggling to see the systemic change necessary to take older people's rights into account in humanitarian settings. Failure to take action is a serious breach of older people's humanitarian rights, human rights, as well as a breach of the humanitarian principles that all humanitarian actors have committed themselves to. But it also undermines the quality and accountability of humanitarian response, as well as putting more lives at risk. So to make the changes necessary to improve the humanitarian response for older people, we believe that 4 key steps are necessary. First, governments, humanitarian leaders, decision makers, and organizations responsible for humanitarian relief must provide the leadership necessary to their partners and staff. They must make it clear that humanitarian principles cannot be achieved without taking into account the rights of older people. Second, humanitarian actors and agencies must take responsibility for responding to the rights and needs of older people alongside the work of specialist agencies. So we must mainstream older people's inclusion. Third, this can only come about if data and analysis is strengthened. And this is a point that Matt made very, very well in his own presentation, and it's important just to re-emphasize that accurate information is essential for upholding humanitarian principles and basic human rights. But finally, if we do not place the inherent dignity of older people front and center in our response by consulting them directly, we will have failed to uphold the most basic of human rights principles, but we will also be undermining making humanitarian interventions more effective. Thank you very much.
Thank you very much, Ken Bluestone, for another excellent presentation. It was very helpful for us to understand ground reality once again. As you know, previous session talked about 2 specific realities. There is a Rohingya camp in Myanmar, Bangladesh, and also North Nigeria. But his report, the title, "If Not Now, When?" Very compelling title, brought us to the broaden our perspective. The 11 countries, as we see in the report, starting from Pakistan, Yemen, Ethiopia, Tanzania, Mozambique, Malawi, Zimbabwe, South Sudan, and Jordan, Northeast Syria, and Venezuela. So we now have the really global understanding about the ground reality in terms of humanitarian crisis, especially the older persons. So with these 2 presentations about reality on the ground, now we are going to talk more normative and also policy approach. So for this, I have the distinguished expert, Dr. Jang Eun-ha. She's a director of Korea Women's Development Institute, and especially the Center for International Cooperation. Dr. Jang, we have also 20 minutes, please. Yep.
Hello, very nice to meet you, and thank you for inviting me to speak at this very important session. I come from a Korean Women's Development Institute. This is a government institute dedicated for policy and legal research for gender and family issues in Korea, but we do a lot of international researches, ODA research projects, and development cooperation. Let me explain a little bit about my background, and that may actually add on to my presentation today. I have been studying humanitarian assistance, especially in conflict, for the past more than 20 years. But it was the first time, actually, that I was approached to speak at this kind of a conference on the topic of humanitarian aid and older people. So during my career, it was always in my mind that why no one talks about really older people in humanitarian context, especially during conflict and also natural disasters. I knew that HelpAge International was very active on the ground, and they were like the main major advocate for older women's rights and also their assistance. But it's not really openly, it has never been like a global agenda, this older people's rights, assistance, their needs, especially during the humanitarian context. So I was very surprised, yet I was very happy that now this topic is addressed, especially in this global international conference. And it was actually my first time to actually look deep into what was going on. And especially because now I am in a gender institute, I'd like to, in this presentation, give you a little bit of gender perspective and how that complicates all this already very complicated situation. Let me first give you a brief introduction about the situation of older women in humanitarian crisis. So my main point is that gender inequalities continue into older age and are compounded by age-based inequalities. So older women face multiple barriers and discrimination, not only barriers, but discrimination, shame, stigma, normalization of violence. Previous speaker have talked about this woman who has faced more than 4 times of humanitarian crisis during her life. Lack of awareness of services because they don't know where the service is provided, and they cannot actually go to the service sites to get access to some of the food, non-food items, shelter, etc. The intersection of gender inequalities with other characteristics such as disability, poverty, marital status. Many people are widowed during the conflict situation. Literacy levels can accumulate over time, a lifetime, and be exacerbated in older age. So here, I'm emphasizing the intersectionality of the vulnerabilities. For example, the illiteracy, a woman who cannot read. 72% of older women surveyed in this survey by HelpAge could not read or write. So if you compare this number to men only 35%. One of the few studies inclusive of older women in situations of protracted displacement was conducted in Eastern DRC by Oxfam and HelpAge International 2010. And it revealed that over 15% of these seeking health services for sexual violence were over 55. So here now I'm talking about gender-based violence in these settings. Our previous speaker mentioned briefly about this. Somehow we assume that these don't happen to older women, but it does happen to older women. Women over 49 experienced rates of sexual violence on par with the rest of the population. So it's really hidden. GBV in the first place is hidden. It's really, for women and girls, it's hard to report their cases. And for older women, it becomes harder because of all the things that I talked about. They are not very well in terms of health. They cannot read or write. They cannot move. So all these difficulties actually worsens older woman's situation, especially when she became victims of gender-based violence. However, here I talked about all these vulnerabilities, but older women can contribute and they are contributing to community with their reproductive, productive, and community roles. For example, reproductive role, they are the main caregiver. So they provide unpaid care work for family members, grandchildren, etc. Productive role, unpaid work in the household, unpaid work in the community, informal economy, they sell little things on the street, etc. Community work, they are actually involved in many community-led initiatives, and some of the cases were found in NGOs on the ground. Okay, these are research. This is a very rare research. I had a very difficult time finding older women's situation in humanitarian settings. There are lots of research on women and girls in humanitarian settings, but when you add one more layer, which is age, it was very hard to find the specific research that considers older women. But here, the Help Age International, here are some statistics that show how older women are far behind older men in terms of many aspects. So for example, in protection-wise, about 6.26 of older people, and among them about 73% of women reported experiencing at least one type of violence. So in terms of violence, women are becoming victims. And in other assistance items, if you actually go and look into some of the statistics, it shows that women are more affected by these difficulties. I'll just skip because I'm taking too much time. Now, I'd like to talk a little bit about GBV in more detail. So against our assumption, GBV are happening against older women in humanitarian settings. Older refugees are often overlooked or not identified in data collection in the base. So it's not only older women, but older men as well. They are overlooked in terms of data collection. Risks and needs assessment in regards to violence and abuse, they often focus on girls and younger women only. Older women are often excluded from unable to access the services, the humanitarian services. And it's very little is known about the gender-based violence against people over 49 because not many programs include these populations in their GBV response programs. Only anecdotal data, anecdotal stories on GBV is existing. It was very hard for me to find any sort of anecdotal data either, not mentioning the statistical data. So these are unheard, unseen. Serious abuses such as rape and gender-based violence go unseen and unchallenged. So situation is not very good, right? The experience, but there is not much being done. That's what I want to mention in this slide. So experiences of older women remain largely invisible, despite often facing both gender and age-based discrimination. So the major problem is that we don't have that disaggregated data, very detailed, that considers gender, age, and disability. Because if you have this kind of data, it's really, it becomes easier to identify older women because old is age, woman is gender, and disability because many older people face a similar situation with disabled people. So if you have this data that considers these three elements, it becomes much easier to find their needs. So invisibility of older women's rights, experiences, and needs, and the lack of specific frameworks to protect this is a huge problem right now in dealing with older women in humanitarian settings. I found this little photo from the internet that kind of really touched my heart by, again, Help Age International. One Tanzanian activist reported that, unlike other crimes, violence against older women is accepted. Older women count too. So I think it's really time that we start to look into this issue, GBV, for older women. I'll just, because I'm just continuing what I've just mentioned in previous slide, I'll just continue to read what I have on my slide. So taboo and stigma that often surrounds violence faced by older women is likely to lead underreporting, just as I mentioned. The lack of data and knowledge on the types, drivers, perpetuate prevention and response strategies. Factors that increase the likelihood of exposure to violence among women include poverty, low level of education, and non-employment. So if you survey older women in this humanitarian settings, a lot of them are illiterate. And just imagine how this illiteracy could affect all the complications that they already have. So I've suggested some more statistics in next sentences, especially many women are widowed in this situation. So that makes their economic situation harder. When I was preparing these slides, it was extremely difficult to find, as I said, exact statistics that shows the situation of older women. Not only statistics, but it looked like older women in humanitarian settings, their specific needs is being neglected. So these are some of the measures that I've actually thought about for a long time and came up with some of these suggestions, combining all the reports that I read, also by Help Age International, etc. So first of all, as my previous speakers have spoken about, we really need an inclusive response to older persons in humanitarian emergencies, including guaranteeing their access to the services. We need to consult them when we do the needs assessment analysis. Not only that, we need to find out how they could actually participate in these humanitarian aid efforts. And also not only that, but we really need their feedback in monitoring and evaluation phase. And I'm going to explain in more detail how we can do this in my next bullets. So in humanitarian settings, even though when we do the needs assessment, it's really emphasized that we do gender analysis, even in humanitarian settings. Even if this is a rapid assessment, it's required that we do the gender analysis. And now I suggest that not only gender, but we also need to include age. So I suggest gender and age analysis should be done. And here, I suggest that it's not only, we've listed so many vulnerabilities in my slides as well, but I really would like to emphasize that we need to find out what capabilities these older people, and especially older women, have in the community, in the family, because that's about their dignity. So I've thought about little roles that older women play, mentor, especially for the girls and women in reproductive age, because they have gone through. And also, we talked about caregiver role. This is a very important role where, especially during conflict, where many men are out there fighting, or they migrate other cities to earn money. So it's their caregiving role. And And also you find in these communities that older women work as, they have the skills to attend birth. So in this, even in this like refugee camps, older women play a great role in attending babies. So I don't know like which kind of role they play in each community. Maybe they have a very different, very positive role. So when we do this analysis, I really strongly encourage that we find out their capabilities in the community and the family. My third bullet is I suggest that we really should take a rights-based approach, and this is what our previous speaker talked about, the dignity. Having like only like latrine and kitchen and sleeping space in all in, you know, a little tent. This is not a dignified life. So when I talk about rights-based approach, it's really important that we give them some sort of choice about where they are going to live, how they will be living. I know it's very difficult in humanitarian settings, but if you, as someone who plans these programs and projects, if you have this in your mind to begin with, I believe this kind of approach will actually result in some different outputs in the end. Next, especially for women, this is very important, and I think many women in this room agree, a life cycle approach. And this is not only in humanitarian settings, but I know that in domestic policymaking as well, life cycle approach is what like gender policymakers are arguing for. Women goes through, because of their reproductive roles, they go through vastly different stages of life with their changes in their body. So I think this should be very much considered, especially like women after going through menopause, after menopause, and also some people talked about psychosocial illness. We really need to take that into account as well. And the next, GBV issues, I won't go into in more detail, but we really need to assume that these are happening to older women too. And unfortunately, there are possibilities that humanitarian practitioners, workers, they may be exploiting the older woman. So unfortunately, and it's very sad, but I strongly encourage that practitioners and policymakers all assume that these are happening. And then my next point is about gender, age, and disability, disaggregated data that I've talked about in my previous slide. I actually have one more thing to say, which is an example of how gender and age intersect, and then that creates further vulnerability of older women. I'd like to introduce this illness, eye disease, trachoma. I have a good eye doctor friend, and when we were talking about some gender issues, he introduced me to this disease. There is this disease that's really prone for women, and especially for older women. And he introduced me this disease, and many people already may know. This happens not only in humanitarian settings, but in peaceful times as well. Trachoma is a preventable infection that impairs the vision of so many people worldwide, and some people actually go blind because of this eye infection. When doctors actually examined this, they found out that women were 1.8 times more likely to have this disease, and they were questioning why. This disease looks very gendered, why? This is a waterborne disease, so contaminated water causes illnesses for all, but women and girls, they are more affected, and especially during this COVID-19 pandemic where the water sanitation hygiene becomes more important. And my last slide explains why this happens more to women, and especially older women. So over the course of the lives, women spend more time with children than men. And this disease, trachoma, the germs, it's transmitted easily by children for some reason. So who are taking of these children? It's usually sister, young woman, mother, and then in later in life, like grandmas, right? So this becomes a very gender-specific disease, and they become exposed to these germs. So if you look at this, the picture, when woman becomes old, the likeliness of having this disease becomes higher because women play this role as a caregiver during her life cycle. So I'm giving you this as an example that when we do needs assessment, even in humanitarian settings, we really need to look for this kind of illness that, or disease or situation where gender and age intersects and creates further vulnerability. That's the end of my presentation. Thank you.
Thank you very much, Dr. Jang Eun-ha. Let's give a big hand for her. So thank you for another excellent presentation. I was wondering whether you have found a common among three presentations. You know, we have a presentation by Matthew, Ken, and Jang Eun-ha. And of course, there are many common words among three presentations. For me, which was not striking, but which is very interesting, is data. Data was the word by the three speakers, because through data we understand ground reality. Through data we can develop policies. Through data we can develop relevant norms. So I think data is very, very important, but probably the older person, as many the experts presented, you know, the data is one of the biggest challenges to address the human rights of older person, particularly in humanitarian crisis. This intersectionality, this is a very popular term among experts, but not so much popular among ordinary people. You know? So from ordinary people's point of view, it's a common sense, you know. Not every older persons are discriminated. Not every children is discriminated. Because when it comes to intersectionality, because not only they are older person, but also they are minority or person with a disability or something else, you know. So in that sense, I think the intersectional approach is very important in order to understand ground reality better and also more contextual manner, you know. So traditionally, as you know, we have the human rights-based approach, and there was a gender-based approach, or gender-sensitive, or responsive, or gender-transformative approach. But when you bring this together, gender, age, especially from the age point of view, life cycle approach is also a contribution to the human rights-based approach. So they make it more inclusive of the older persons. Thank you for helping once again to learn about this important approach. And now we are moving into the last presentation, which was very interesting because it's a normative and policy practice. You know? So we have listened to two presentations about ground reality through the report and research, and also this policy tool about intersectionality. And before we have the last presentation, I'm going to let the two previous speakers. One of the questions I'm going to raise during the Q&A session or interactive dialogue is, what is your response to this intersectionality and a normative framework from your own experience as a practitioner and the researcher on the ground? You know? So you can prepare for that question. So now, happy to introduce the last speaker, but not least, Supriya Akerka. You're also London, right? Where are you? Are you in London or unmute, please?
Yeah. I'm based in Oxford.
Oxford, also is UK, right? UK. So must be early in the morning. Thank you once again for joining this program. I know this is a very difficult time for you, you know. So thank you for staying with us. Okay, so you have also 20 minutes for presentation. Okay, over to you.
Yeah. Okay, so I'm going to start with the sharing. Can you see the slides?
Yep.
Okay, thank you very much. First of all, thank you very much for inviting me to this ASEM forum on human rights of older people. So, and a big congratulations for the organizers in not only this session, but also organizing the whole conference. So my presentation is going to be about older people in humanitarian crisis, but I'll also be focusing on discourses and the current normative frameworks that we have the gaps between policy and practice. I work at Center for Development and Emergency Practice, Oxford Brookes University. I'm also the course leader for the master's program in Development and Emergency Practice. So it's quite possible that I may be, reiterating some of the facts that the earlier speakers have spoken, but that's not a bad thing. So again, let me start with a very brief context analysis. We know that today more than 21% of the population will be over 60 by 2050, and so that's a trend that we understand. And we also know that there are more older women. For every 83 men, there are every 100 women over the age of 60. And 46% of these older people also have a disability. And again, what this all means is that older people are a very diverse group, and they have a lot of diversity of experience, knowledge, and skills. With the fact that some of them may be women, men, again coming from different occupational groups, and also abilities. Now I'm just going to give you a very short sort of snapshot about older people in humanitarian context, and just to highlight some of the issues that perhaps the earlier speakers may have also spoken about. Now we know that in the last 2 years there has been COVID-19, that's a major humanitarian crisis, and a high disproportionate deaths of older people and people with disabilities have been observed. And 40% of those deaths have been from the care homes. So that's in itself is a big issue. If you go to the tsunami in Japan in 2011, we again find that 56.7% of the total deaths were of people above 60 years. Then if you go to Hurricane Katrina in 2005, again we find that 75% of those who died in the wake of Hurricane Katrina were 60 years or older, although they were just 16% of the pre-hurricane population. If you go to the 2003 European heat wave, it led to 53,000 deaths, of which majority were elderly. In South Sudan, elderly refugees over 50 years were dying at 5 times the rate of those aged between 5 and 49 years. And if you go to Nepal earthquake, the food, we again find that there is evidence that the food aid was not responsive to the needs of the older people, and the shelter and the wash infrastructure was also not disability inclusive. I think the earlier speakers have also mentioned, I think it's quite important to understand the overlap between the situation of older people and people with disabilities, particularly because more than 40% of older people do have at least one disability. We also find that in relation to the Syrian refugees, this is in Lebanon and Jordan, 10% of the Syrian refugees were with disabilities, and again, those specific needs went unmet. And a SENDEP ActionAid Philippines participatory assessment study, which we had done in 2015, had also shown that older people and people with disabilities were unable to access the livelihood opportunities, cash for work after the Typhoon Haiyan in Philippines. We also find that although typically older people and people with disabilities constitute 25% of the typical caseload, they are often invisible, and a HelpAge study also found out that out of the 6,003 analyzed projects, only 47 or 0.78% included at least one activity targeting older people, and only 13%, 18 of those were funded. So again, it shows a very high underrepresentation of the of responses to older people in the mainstream humanitarian organizations. And one of the important findings by the Interagency Standing Committee in 2010 was that humanitarian response, continued to marginalize the needs of older people and people with disabilities. So, I mean, in a way, it sort of summarizes a lot of the things that I've, spoken in the earlier slides. So, what does it really say? I mean, the fact that you have disproportionate deaths, the fact that older people's needs are not really met in humanitarian crisis, what does it really tell us about the humanitarian imperative that the humanitarian actors are bound to follow, and the human rights affirmation, which is really based on non-discrimination. So if you look at the humanitarian imperative, all people should be receiving the humanitarian assistance without discrimination, and that is the right of the people. You have the Universal Declaration of the Human Rights, which says that everyone is entitled to human rights without distinction of any kind, and prohibited grounds are the color, sex, religion, politics, nationality, or other status. And that part, other status, is quite important because that also brings in age into the domain of the Universal Declaration of Human Rights. But what we find, as you saw from the earlier slides, the case examples that I gave, that the case example shows a violation of both the humanitarian imperative and human rights gap. Now, what may be the reasons for that? So one of the issues which has been highlighted by the IAC has been that there are capacity gaps within humanitarian actors. And this really brings me to share with you to some the project called Age and Disability Capacity Project, which was from 2014 and 18, and it was actually coordinated by HelpAge International, and there were a number of organizations which participated into this initiative. And CENDEP, Oxford Brookes University, was a research partner for ADCAP, and I was involved as a lead researcher to understand what were the learnings from this initiative. So I'm going to share some of the learnings that we have gathered from this study, and as a part of that, we had also published this good practice guide embedding inclusion of older people and people with disabilities in humanitarian policy and practice. So that brings me to some of the highlights as to, why is it? What is it that leads to the marginalization, invisibilization of older people and people with disabilities in humanitarian responses? So ageism, again, intersecting with disabilities and gender, and as earlier speakers have also pointed out, that just means that, if you're an older woman with disabilities, your discrimination and marginalization is compounded. And then there are certain discursive assumptions which are made by the humanitarian actors about older people and their operational environments, which again lead to further exclusion and marginalization. And unfortunately, in many contexts, these discursive assumptions are often normalized rather than critically questioned, and that is a part of the problem. So what are these discursive assumptions? A, that they are not mainstream. What I mean by mainstream, I should have put it in the quotation marks, is that, in many contexts, the typical person of the humanitarian aid is considered maybe to be the younger adult, younger male, but that just means that, that older people, older women and men are excluded from the mainstream institutional responses and services, whether it is health, education, vocational training, among others. The second discursive assumption is that, well, older people are vulnerable. But that doesn't really help us if you're going to look at older people as vulnerable, because what it does is to contribute to the idea that older people and people with disabilities do not have capabilities and the agency of their own. It denies voice to the people with disabilities. They are denied participation. They're often represented by others. And more importantly, just to call people vulnerable can also deflect from the larger context which leads to their vulnerabilization. So it deflects attention from the causes of their structural exclusion, the different barriers that make their participation difficult and invisible. The discursive assumption 3 is that, well, older people are unproductive. They can be objects of pity and right, but not of rights, and so excluded from livelihoods and other programs which are initiated by humanitarian organizations. discursive assumption 4. Well, this working with older people needs specialist work. So it's best that we leave specialist organizations such as HelpAge International who are equipped to work with them. We really can't really, mainstream their needs or responses to them in our work. But what is really this whole idea that only specialist organizations are equipped to work with them leads to is that they are marginalized from the work of mainstream organizations, and also the whole humanitarian cluster systems around which the humanitarian response works takes place. Discursive assumption 5, a belief that we are already working with them. Well, some organizations think, well, we are working with older people, and so they are inclusive. But that doesn't again help, because what you really need is an understanding, a contextual understanding of the barriers. And if you do not have that understanding, then your lip service may continue, and lip service to older people may just continue. Discursive assumption 6, that they are poor value for money. Well, there is an assumption that it needs a big budgetary allocation and increased programming cost, and therefore this is really poor value for money. So again, so what enabling inclusion really means is that, we should be able to, the humanitarian organizations should be engaged in challenging these discursive assumptions and the varied barriers, not being a part of it and not really normalizing all these assumptions. And what is also therefore needed is also mainstreaming inclusion in all humanitarian response work by all organizations wherever they are responding. Now, there are some key guidances for capacity building by humanitarian organizations, which really talk about engaging with these discursive barriers, discursive assumptions, and the different barriers. And I just want to flag out a few. The ADCAP Humanitarian Inclusion Standards for Older People and People with Disabilities, and the ADCAP Good Practice Guide for Inclusion of Older People and People with Disabilities and Humanitarian Policy and Practice. And then you also have other excellent guidances by UNHCR, the HelpAge IFSR, IFRC Shelter Guidance, and the Older People in Emergencies, Considerations for Action and Policy Development by David Hutton, and the Sphere Standards. So, so there are a lot of guidance already available, which suggest as to how can one engage with the discursive assumptions and also the different barriers which lead to the exclusions of older people. So that's about the what's happening out in the humanitarian sector, the capacity building guidelines and the analysis around that. Now I want to talk a little bit about the existing normative frameworks, and I'll speak as to how I have sort of matched both some of the guidance and also the existing normative frameworks for older people. So I've taken into account these few normative frameworks. We know the Universal Declaration of Human Rights, which really highlights the principle of discrimination, the convention, and then you have specific sort of normative frameworks such as the convention and the protocol relating to the status of refugees. You have the Refugee Convention, OAU, you have the Madrid International Plan for Action on Aging, the UN Convention on Rights of People with Disabilities, the CEDAW recommendations on older women, and the Inter-American Treaty on Human Rights of Older People, the Global Compact on Refugees, then the EU Directive for Refugees, and the guiding principles on internal displacement. So all of these different normative frameworks have some things to say on humanitarian context and older people. So what I've done is to map out some of this and to really look at the interventions which have been suggested by these different UN-led normative framework or other regional normative frameworks. So what I mean, when you look at the interventions which have been suggested by these normative frameworks, there are quite a few which are given, and they're quite good. So they do highlight, if you look at the interventions, they do highlight the equal access to food, nutrition, shelter, healthcare, education, livelihoods. Then they also highlight the need for assessments, understanding contributions of older people, vulnerabilities, disaggregation of data by sex and age, involving older people in program planning, making relief workers aware of the older needs, design national guidelines to assist people. And so what I've done is, I'm just reading out of some of these guidances which have been given in the in the normative frameworks. What I've done is to check, to what extent are these normative guidance also sort of, reflected in the guidances that have been developed by the humanitarian sector, the guiding. And so the green highlights that there are currently detailed guidelines available. And in the earlier slide, I'd looked at which are the guidelines that I have looked at. This includes the ADCAP work, but also the other guidances which have been developed by WHO. So the green shows that in relation to the the interventions which have been highlighted by the normative UN and the regional normative frameworks, there is enough guidance available. Then you also have, I have highlighted those guidelines, those interventions which have some guidance but not enough, in the blue. So there is some guidance available on protecting older people against violence, assisting older people for economic self-sufficiency, recognizing the potential of older people as leaders, assisting older people in preparedness, reconstruction, and prevention. But then there is a whole list of interventions which have been given in the normative frameworks for which we don't have enough guidance. And that includes protection of inheritance of the older women, reception areas for older refugees, their registration, support to integrate older people in countries of origin, or supporting the host countries to welcome and meet older people, support to older refugees in detention and responding to their health concerns, and adequate standards of living for older refugees in detention. And you'll see that, a lot of the last 4 areas are around older refugees, and there isn't, as of now, good guidance as to how to respond to these issues. So what, if you take into account the earlier slides and the last slide, which had mapped the normative interventions which have been suggested by the UN frameworks or the regional human rights frameworks and the guidance available, then what we can say is that, yes, I think, a lot of the interventions suggested have been good. They have also been highlighted in the guidance documents. However, if you take a look at all those interventions suggested, we still find that they are very piecemeal interventions, and there are significant gaps, particularly if you start to look at, some of the areas highlighted by the ADCAP humanitarian standards and the ADCAP good practice guide on inclusion of older people and people with disabilities in humanitarian responses. I mean, these are latest insights on why exclusion happens, and they highlight a number of barriers. And none of these barriers and engaging with these barriers are still reflected in the UN normative frameworks. And I just want to sort of highlight, the case of COVID-19 to speak to as to why, to speak to as to how the current frameworks really do not sort of, speak to the issues of barriers and some of the discursive frameworks. So, for example, if you go with the case of COVID-19 in humanitarian crisis, we see that there have been a lot of discourses which have normalized deaths. Now, this is just a photo from a USA, in USA, in one of the, I think, mobilizations, and it says sacrifice a week. So there has been a lot of stereotyping of people with disabilities and older people as less useful, burden to the society, with an underlying message that it is acceptable for the groups to die. And people in authority positions, for example, a former health minister of a country has said that people over 64 are already corpses, and government should focus its COVID-19 efforts on people who are still alive. We also find that, during COVID-19, their discriminatory principles were followed, and the COVID-19 humanitarian response has been singularly discriminative, and that includes older people being en masse and singularly targeted for restrictions on their movement. Now, this may be well-meaning interventions, but at the end of the day, it was a case of medical-based advice trumping the rights of the individuals in arbitrary ways. I may be 60, 65, and I may be perfectly healthy. And that doesn't mean, therefore, that I should be restricted for my movements. There were also inadequate standards of care and regulations in the care homes. And then there were a lot of instances of everyday struggle, discriminations, and violations, where older people did not have, again, access to food, insecure livelihoods, mental health issues, among the others. And so what we find is that, again, in COVID-19, the agency, the right of the older people to be consulted, the recognition that older people's lives are valuable and that they are not dispensable, accessibility, all these rights which should have been, in principle, affirmed by the governments and the humanitarian organizations, or all organizations responding to them, were being violated. And in effect, we can again say that the right to non-discrimination and the equality rights were singularly violated in COVID-19. So again, I just want to, the main takeaways that I really want to highlight is that the discursive assumptions and the barriers which were identified by the ADCAP initiative as capacity gaps continue to hold strength even today. The current UN-led and also the regional normative frameworks, they have some good interventions, which have also been highlighted in the guidance documents by humanitarian organizations, but they are not sufficient. Protection and elimination, protection to eliminate the barriers, to affirm the equality rights of older people in humanitarian crisis. At the most, they can be considered as good, but very much sort of a piecemeal suggestions. And therefore, I think it is only right to say that the UN Convention for Older People to protect their dignity and human rights has to be the way forward. So I'll stop over here. I hope I've not exceeded my time. Thank you very much.
Thank you very much, Supriya Akerka, for another excellent presentation. I think you help us a lot to understand this complex issue of the older person humanitarian crisis from practice and policy, and especially the normative framework. I think your conclusion was very clear, And also, it's not only you, all the presenters, from your presentation, I can make a common conclusion. Our response, humanitarian response on the ground is not enough, policy framework is not good enough, and also normative framework is not good enough. So what to do, There are so many issues here on the table. And also I found one common word, Previously I said that data was a common among three. Can you guess what is a common among all four of you, It's very interesting because you made a separately your own presentation. The common word I found was assumption. Everybody's talking about assumption, That means there are a lot of prejudice or wrong or distorted understanding about reality of human rights older persons in humanitarian crisis. So first, the first challenge is how to fight against this assumption, the wrong assumption, That's why the data is so important. We need to provide the disaggregated data so that people can understand reality on the ground, This is, I think, the first common, that I found, from 4 presentations. And so now, as I mentioned, I'm going to ask the first 2 speakers, Matthew, Ken, you have a lot of ground experience through your practice and research. And then last 2 speakers talking about policy framework, intersectionality, and also even the Supriya made a very interesting suggestion. We need the UN Convention. And her presentation, we found only one human rights treaty on older person. There's an Inter-America system. There's only one. Not in Europe, not in Africa. So not needless to say about the UN, So I'd like to ask Matthew and Ken to respond to this question. Why is important is intersectionality, the first one, and the second one is about why we need a UN convention. So like a CRC is very well known, Convention on the Right of Children, and probably Convention on the Right of Older Persons, CROP, acronym, I made the acronym. Okay, so first, Matthew, your response, please. Why is it important intersectionality on the ground?
Thank you. And yeah, it's been great to listen to all the speakers. And maybe really quickly to pick up, I think it's great that you highlighted that issue of assumption from all four of us, because I think it is so key. And it goes back to, you break down those assumptions by listening to, by including older people in the first place, by involving them. They should be involved in the design of these programs. And it's by the exclusion that we end up with these problematic assumptions. On intersectionality, I couldn't agree more with the other panelists, and that it again goes back to one of the things I tried to highlight, which is that older people are not homogenous. Their experience of conflict is not homogenous, nor is their experience of humanitarian crises. And the experience of older women is often quite different from older men. The experience of older people with disabilities is experienced from those who are able-bodied, and so there is a need always to unpack these intersections of different risks, of different identities. Also around, poverty, there are enormously different experiences based on whether one is an older person of relatively high status economically from those who are not, and so all of these need to be examined and unpacked if we're going to design a response that truly meets the rights and needs of older people. And so, yeah, I can't agree more. Very often in the work that I've done in places, you see particular forms of discrimination against older women in particular. And we saw the quote that I had from the older woman in Northeast Nigeria. And very often older women in particular are not included when these sorts of assessments are being done. They're particularly marginalized. And so there's an enormous need to better include older women in particular.
Okay, thank
on
you.
The normative,
can you make it short? Yep.
Sure, absolutely. Just to say on the normative framework, again, I agree, but I think we also need to recognize that even where there have been normative frameworks in place, that still the response has been woefully lacking. And Ken spoke quite a bit about this in his remarks as well. And that so much of this falls back on resourcing, and it falls back on discrimination and an undervaluing of the lives of older people in the first place. So while we need to build that normative framework and plug the gaps that exist today, there also has to be a much bigger fight around resourcing and an end to the discrimination and how we see older people through ageist assumptions in the first place. Thank you.
Okay, thank you, Matthew. Now for Ken, Dr. Zhang, she mentioned about several components for intersectionality in terms of age, life cycle analysis. She mentioned about, of course, gender, disability, poverty, marital status, education, literacy, the many, So from your own research, what is your view on this intersectionality from your own experience?
Thanks. And I would like to tie that into some of the previous comments that have been made. I think one of the key things, we're all agreed that actually what we need to be doing is looking at the diversity of the human experience. That is when we get older, and what we can't do is to separate out a person into separate components. We have to look at the whole person, and that is what we mean by intersectionality, is recognizing what those different experiences are. It only becomes challenging for us when we start to put these different lenses on things, and we start to put obstacles in the place of seeing that person. When we look at the issues of intersectionality and gender, a huge amount of work has taken place over the decades to get the inequalities recognized and to have the contributions of women recognized, and to put in place the tools in which we can begin to understand better what are the economic contributions that younger women are making. But when you add the dimension of age to gender and to gender analysis, what we stopped seeing, and what policymakers stopped doing, is stop looking at the gender dimension. What they only see is the older person. Mm-hmm. And so where you have women's economic empowerment, the economic contributions, the care contributions that women are making, that the role, the activity that older women are doing in this area just disappeared. They become invisible. They are no longer seen as carers, but they are seen as recipients of care. And the question we have to, and the same for disability, where you have a person who is living with a disability, when they become older, sometimes in terms of statutory entitlements, how they are viewed by society changes entirely. They are not seen to be a person that has statutory rights as a person with disabilities, or perceived as a person living with disability that has specific rights, but they're seen as a person who is older. And we need to ask the question, what is it that is giving us the permission as a society to do these things, to make these choices, to put in place these arbitrary choices, this level of discrimination? As you know, the World Health Organization released earlier this year a global report on ageism, and ageism is the backdrop, that sense of that internalized discrimination, both that we all have as individuals, but also that we place on others. And this is where this question of normative frameworks is so important, and why we have to come back to the question of a convention on the rights of older persons, and why it is so necessary. It's necessary because, yes, we do need that legal certainty, that clarity about how do we protect the rights of people in later life. But it's about the process of achieving it. And the one thing that a convention can do, which is the process of creating a convention, that is different from all of the other normative frameworks that we've seen on the screen, is that it can shift and change the narrative and the perspective of society as a whole as to what does it mean to be older, and shift our understanding of older people from the people that we do things to rights holders, in their own rights and perspectives. Yeah. But Matt is right. The piece of paper on its own isn't sufficient. Yeah. What we have to do is to have a process in which we, first of all, involve older people directly in the raising awareness of their own rights, but also in understanding what their experience of aging is, so that we can create the right set of guidance through a new convention. But it's about the process of involving all generations, so that way we
sorry, there is a connection problem. Okay, thank you very much for Dr. Ken for highlighting the importance of intersectionality, especially the importance of narrative and also perspective on the issues of the older persons in humanitarian crisis. Now let me ask Dr. Zhang. There was a question about we need the UN norm, UN Convention on the Right of Older Persons. This is a suggestion from the SPRIA. And also we have another global framework, normative framework, which is SDG, the Sustainable Development Goals. Because when you talk about humanitarian crisis, we can approach from the human rights perspective. There is a UN human rights norm. The other one is SDG, because humanitarian crisis is issue of developed cooperation. Because SDG is a general universal framework for developed cooperation. So you have both experience of human rights and developed cooperation. So what is your view of why it's important to bring this issue of the older person humanitarian crisis linked to the UN global norms and also SDG? Do you have any view on these issues?
Yes. Is my mic on?
Oh, press.
Oh, press.
Oh no, press again.
Again. Okay. Thank you for that question. I think it's long past time that we come up with UN Convention on Rights of Older Person. Thinking how important this issue is and how we have been so negligent on this issue. As for your question, between or considering this UN Convention on Older People and also SDGs, I certainly think that both two have a reinforcing effect. Why do I think like this? Because thinking about SDGs, the Sustainable Development Goals, and the basic philosophy of this is, as we all know, it's leave no one behind. When we consider no one behind, that includes, of course, older people. In SDG, luckily and thankfully, we have women as a separate independent goal, Goal 5, gender equality and women's empowerment, so that's good. Children, it's actually mentioned, it's not a separate goal, but it's mentioned, I think in goal, the peace goal.
16, goal 16.
Or 16, yes,
Yeah.
There. For disabled people, we do mention, we have mentioned here and there, but for older people, I don't see it very clear in SDGs. So, in realizing the philosophical background of SDG, leave no one behind, making this UN Convention on rights of older people, it will certainly complement SDG spirit in realizing SDG spirit. And just thinking about it, we have UN Convention on Women, the CEDAW, and children, and disabled people, but not older people. So this will be complementing SDGs. Also, SDG will become a philosophical foundation to establishing UN Convention on Older People, because now SDG, everyone knows and we all agree with this leave no one behind spirit. So I think this too has a reinforcing effect, and it has to be actually go hand in hand.
Okay, thank you very much. We have only 9 minutes left, so I'm going to ask one question to Supriya. After that, question to all, so your final remark. For Supriya, you mentioned about importance of the UN Convention. My question is, this is ASEM, ASEM is composed of Europe and Asia. And Europe, many of European countries belong to OECD, because OECD play a very important role in the policy making of older persons. And from Asia, South Korea, Japan, the member of OECD, OECD has a DAC, Development Assistance Committee, which deals with the ODA. So my question to you is, how we can mainstream your idea, if not UN, first maybe you can try within ASEM countries, Europe. As you mentioned, it's only Inter-American Convention on person is older person. What about Europe and Asia? Then we move to UN. So how to mainstream this idea into ASEM countries first? Do you have any idea and suggestions?
Okay, I think that's an excellent, suggestion possibly, as a way forward. Yes, I think the Inter-American Convention, has been quite useful, and I think the regional countries have ratified it, and they are really using that convention also to make their own societies conscious, but also using it to further the rights of older people. So yes, I think one way of looking forward is to also have some more regional conventions which may include Europe and ASEM. And I think when you look at the normative frameworks that I've highlighted, there were some normative frameworks that I also highlighted in relation to the Europe directives and in relation to refugees. And when you look at those normative frameworks which are endorsed by Europe, and I think we find that yes, you have also the European human rights directives. So there are a lot of this, the regional directives presently they are there, but they don't have much to say on the rights of older people. So there's still a major gap, I would say. So yes, in principle, even some of these regional frameworks talk about equality, discriminations, but there is really nothing which speaks about, non-discrimination and affirmation of rights of older people. So I think that's also a very good idea that, you actually take a deeper look at some of the existing, normative frameworks, which I've also highlighted in my presentation. But again, I think they show that there is a very piecemeal approach, and we really do not have enough understanding of or enough affirmation of the older people's rights in those current regional frameworks also, the regional normative frameworks, particularly in Asia and Europe. So I think it's a good example, possibly a good way to move forward. And I think I just want to reflect on one thing that I think one of the earlier speakers mentioned, probably Ken and Matt, I think. that yes, I think, the normative frameworks can be very powerful in mobilizing older people, mobilizing the public opinion, against the discrimination. And I know that the UN Convention on People with Disabilities, or even the CEDAW Convention, have been mobilized by women's groups, by groups working with people with disabilities, and they have been mobilized to to highlight the rights. So I think they are very significant, these conventions, in mobilizing the public opinion. They give a statutory sort of a framework for affirmation of the rights. And although, of course, that's not enough, I think they can be very powerful in mobilizing, opinion and also public consciousness against discrimination. So I think the UN Convention for Older People's Rights is very much, I think, needed and part of the need for today. And yes, a possible way could be, as you say, the regional conventions.
Okay, thank you. So now the final remark. So maybe you can pose one keyword, and in terms of lesson learned from this session, also take away. I used to teach, I'm still teaching about human rights and SDG in some universities, and then always I raise this question. In the 80s, we have a CEDAW, Convention on the Elimination of All Forms of Discrimination. And early 90s, we have a CRC, Convention of the Right of the Children. And 2006-8, we have finally Convention on the Persons with a Disability. So what next? What next? And then very few people say the Convention on the Right of Older Persons. Many people something else. So that's why I was wondering why. Because it's a logical. We have children, right? We have a disability and women, and the next one should be the older persons. But many, of course, students, they are young, They are not old enough to realize their future right, Probably that's the way. So that's why you mentioned, all of you, about perception, perception or assumption, So now question, the keyword, Matthew, in one word, what is the main message you want to ASEM, ASEM political leaders, how to mainstream the right of older persons, including the humanitarian crisis. 1 minute, please. Matthew first.
Thank you. My one word would be inclusion. And the idea is to be that in all aspects of humanitarian response, whether from donor funding to the way that planning is done by UN agencies and humanitarian NGOs, to how everything then happens in assistance being delivered, that there needs to be a specific mindfulness and inclusion of older people in all aspects of the response if we're going to do this better. Thank you.
Okay, thank you. Inclusion. Inclusion is precondition for participation and ownership and so on. Okay, now the Ken Bluestone, please.
I'm going to use 3 words, but I'll be brief. First is practical. Address practical needs. We have to create space in which the humanitarian actors are able to incorporate the lessons that we've been talking about. Second is leadership. We need to have that top-level leadership and that reframing and the environment, the normative and convention that we're talking about, and the third is attitudes and understanding. We must reframe people's attitudes and understanding to older people. Thank you.
Okay, very good. The leadership that has a practical mind and also good attitude. Okay, thank you. Now, Dr. Zhang, you have 1 minute.
It would be older people's lens as opposed to gender lens that we talk about, because I was going to say exactly the same thing as Dr. Bluestone just mentioned. We need to do something to change, the normative framework, UN convention, whatnot. That will take some time. But on the ground right now, we need to really fix the situation. So having older people's lens and thinking out of the box that can change, just small change in implementing your project, it could, deliver a different outcome. So, yeah.
Okay, older people, like a gender lens, we need the older person's lens. Okay, Supriya, please.
Yeah. Okay, so very briefly, I would say end discriminations, and particularly the intersectional discriminations, I think, and affirm the rights. And I want to emphasize the intersectional discriminations, although I didn't say too much, but on that. mainly because it is really important to understand that intersections are really lead to overlapping discriminations. So you can't really look at discrimination from one perspective. It's a more complex reality, and it's very important to affirm that intersectionality to ensure the diversity that we spoke about. Experiences of discriminations are actually responded to. Otherwise, you might still have at the end of the day a male, with due respect to men, or a young man as the when we talk about discrimination, looking from that perspective. And so, very important that we address the intersectionality, intersectional discriminations.
Okay, thank you very much, Priya. If I were to say one word, for me, I would say intergenerational dialogue, intergenerational. It's inclusive of all ages, because as I said in the classroom, this day we are talking about future generation. There was a UN General Assembly, there's a special session about future generation, and BT was invited to UN General Assembly on the session, the SDG moment as well. So, but older people are future generation of young generation, Everybody has to come to this older age, That's why it has to be really extremely with the young people. So more solidarity between the young generation and older generation, I think that can be also a very important strategy to mainstream the age in the international norms and so on, And also, before end, I would like to thank, we practice in this conference the disability-sensitive approach. That's why we provide the sign language. So I want to, on behalf of all the participants, express our gratitude to the interpreters, of course, English, Korean, and also especially the sign language, so that more people can join in this session. And also, of course, all the speakers from London and Washington. I know it's a very difficult time zone. Thank you once again for joining this session. So let's give a big hands to all the speakers and those who made this session possible. Thank you.
Thank you very much, Executive Director. Well, in order for the older generation to enjoy the well-being and to be treated with dignity and for their voice to be heard, we will have to come up with more dialogues like today. So once again, thank you very much, Deputy Director Wells, Advisor Bluestone, Dr. Akerka, and Director Chang for joining us for the session. And also, of course, our big thanks goes to, once again, the Executive Director Lee for moderating the session. Well, ladies and gentlemen, this is the end of the second session. And before we move on to the third one, we will have a break for lunch. So please enjoy your lunch, and we will see you all once again at 2 p.m. Korean Standard Time. Thank you very much. Welcome back, everyone, to the ASEM Forum on Human Rights of Older Persons, Present and Future. I hope that the break was enough for you to digest what we have learned so far. And now we're going to move on to the third session entitled Older Persons in Climate Change Natural Disaster. With me on stage, Dr. Jo Young-suk, Ambassador for Gender Equality, will be joining as the moderator, and Dr. Kim Hong-soo will be joining us as the speaker. And now it is my honor to pass on the microphone to Dr. Jo Young-suk to lead the session.
네, 이제 반갑습니다, 여러분. 세션 3입니다.
Ladies and
기후변화
gentlemen, good afternoon.
자연재해에서의 노인.
We are going to start the session on the theme of older persons in climate change and natural disasters. We have many online participants and 2 online speakers, and we have 1 speaker on site. So we have a total of 3 speakers for this session.
기후변화 자연재해에서의 노인에 관련되어
So under the theme of older persons in climate change and natural disasters, 3 speakers will deliver their presentations, and I will give 20 minutes to each
그리고 온라인을
speaker.
통해서 여러분들께서
And we have online participants, so if you have any questions, please ask the questions on the chat box so that we will pass the questions to the speakers. And then we will have a Q&A session to give you answers to those
먼저
questions.
이 온라인을 통해서 파티마 주리다
First, we have Deputy Director General Fatima Jurida Bidi Saleh of Ministry of Women, Family and Community Development of Malaysia is here with us today. We cannot give her a big round of applause, but please welcome her with sincere attitude. And second, we have Director Sarimutia Timur from Yakum Emergency Unit of Indonesia, and she's going to deliver the second presentation, and please welcome her with a big applause. And last but not least, Professor Hong-soo Kim is here with us today. Now she is next to me. Thank you very much for joining us today. Then without further ado, I'd like to introduce myself. I'm Ambassador for Gender Equality, Young-suk Jo from Korea Women's Association United. Indeed, I'm working as an ambassador for gender equality, so I will take some questions regarding gender. So just for your information. Then, first, Deputy Director General Fatima Jurida Bidi Saleh will deliver her presentation.
Ms. Fatima, are you there?
Yes, Madam Chair.
Okay, shall you start from your presentation? Yeah.
I'm ready. All right, so may I? Hello, Madam Chair, may I?
Yes, sir. You can start. I can hear you.
Yeah, sure. Thank you very much. Okay, first and foremost, I would like to thank you for the organizer for having me to share an experience and best practices on social support systems for older persons in Malaysia, especially during pandemic COVID-19. So please, next slide. And can we share? Organizer, do you have my slide presentation?
Slide. Would you please press the button of the? Yes. Now you can do. Yeah. And would you please volume up your microphone as well?
All right. Can you hear me?
Yeah, I can hear you, but please volume up more.
Okay. Give me a few minutes, please.
Okay, now you can start. I can hear you. Please go ahead.
So, as you can see in the slide, okay, ladies and gentlemen, as you can see on the screen, this is our outline. First, I'm talking about the impact of COVID-19 pandemic on older persons. The second one, we are going to talk about Malaysian aging scenario. The third one is I'm going to talk about Malaysian older persons and profile, as well as public measures, existing and future. The fifth one is about Malaysian national policy on aging, and after that, I'm going to talk about the special council, and the last one is about the policy and society. Correct. This is the impact of COVID-19 pandemic on all of us, and for your information and judgment, Malaysia is currently experiencing population growth at a rate that is steadily slowing down. According to the latest census figures in year 2020, Malaysia's population will add to 2.7 million, and at present, the number of Malaysians aged 60 years and above is estimated to be 3.4 million, which is 10.6%, and projected to become an aged nation in 2030 due to drastic rise in fertility rate and increase in life expectancy. The Malaysian government movement control order, commonly referred as M2, is a series of national corrective measures implemented by the federal government of Malaysia in response to the COVID-19 pandemic in the country starting on 18 March 2020. The orders have been commonly referred to in local and international media as lockdown. I think this is a scenario all over the world. Instruments encompass restrictions on movement, assembly and international travel, and mandates to the business, industry, government, and educational institutions to curb the spread of the virus. The M2 was extended and flexed to different phases in 2020 and 2021, including the conditional movement control order and recovery movement control order. And several phases have been enacted nationwide, while other measures have been localized to individual states and federal territories or smaller areas. The movement control order was included in the National Recovery Plan, which is launched in June 2021. And the government also implemented the National COVID-19 Immunization Program. And for your information, all Malaysian citizens announced and benefited from the program. And as of yesterday, on 26th of October 2021, a total of 23 million people, representing 73.2% of Malaysia's population, had completed their vaccination. And from there, 3.5 million elderly, so far 3,159,91 as of September completed both dose of the second group, and 3.35 million is still under first. Ladies and gentlemen, I would like to bring you in terms of Malaysia aging scenario. It is increasing life expectancy has led to the increase of all the aging population. Life expectancy at birth has risen from 49 in 1950 to 75 in 2050 due to excellent mental health care, good diet, and high quality of life. It is projected Malaysia can back from birth to 5 in the beginning of 85 in the 2020. Malaysia is experiencing rapid decline in fertility. The total fertility rate has declined from 5 children per woman in 1970 to 3.0 in 1950 and lesser than 2 on 1 in 2010. Women marriage, women education, and supreme participation of women in labor force contributed to this decline. Now, I would like to bring all of you in terms of Malaysia of reform. And according to Malaysian Research Institute on Aging, or My Aging Research in Malaysia, can be categorized in 4 categories. 4 categories. First is about categories poor and unable. The second one is about poor and able. The third one is not poor. and unable, and the fourth one is not poor and able. Majority of senior citizens fall under the fourth category is 61.2%, which are potential to contribute to the development of the country worldwide 55.8%, who will need to be introduced to progress, which can generate income to sustain their life. And 81% of senior citizens will need government involvement to keep the inflation rate low, and 4.1% anticipated government handout. And this is, I would like to bring forward you a topic measures to be supporting for all the issues involving the Indian society in each country are being resulting in the adoption of various frameworks for aging throughout the world people. In the social sector, Malaysia has introduced first, it's about the National Strategic Development Plan of Aging Population. And this one is also about inclusion and employment of Malaysia's aging population. Second one is about employment part-time employees under the regulated concern to encourage flexibility in workplace. And the third one is about the mandatory retirement age range from 65 years to 60 years for both public and private sector. And the last one is about the minimum wage under 2012 to enforce minimum wage to employees in private sector regardless of age. And also, Malaysia has adopted international guidelines towards the total employment protection and inclusion of the older population. Involvement at Magic International Plan of Action on Aging in the year 2002 and Regional Kuala Lumpur Declaration on Aging in 2015 has proven our track. Malaysia owns also the national policy for the RDE that the adoption of the required policy on national policy for all the person and that action for all the person in 2011. This US policy is to develop a caring society, enhance capacity building, advance health and well-being, and address safety and social security of all the adults. And so far, Malaysia also has conflict with implementation of the plan for the first Malaysia plan announced within the government highlighted issues the improvement of activities, provision of accessible healthcare and utilization of ICT for all the persons. The ongoing plan emphasizes the need of a comprehensive database, and there is a need to provide accurate data advice and meeting in formulating policies, legislation, and strategies to cater to the needs of all the I would like to share with all of you in terms of national policy for all the persons, which was developed on 2011. The philosophy of the national policy is to acknowledge all the persons as citizens with a variety of backgrounds and experience, have the right to enjoy a comfortable and respectful life and contribute to the development of the nation. And in terms of policy statements, the government's commitment is to create all persons who are intended with dignity, high sense of self-worth and respected by optimizing the self-potential through a healthy, positive, active, productive, and supportive aging to lead a well-lived life. In terms of National Advisory and Consultation Council for the Ombudsman, it is the Chairperson, Minister of Human, Family and Community Development. This is more on part of the governance in terms of taking care of the elderly and the government, especially the Ministry of Human, Family and Community Development, is was responsible to take care of the older persons National Advisory and Consultative Council for the Older Persons. It established mainly to monitor and evaluate the effectiveness of programs carried out for older persons. The council consists of members from the various ministries and agencies, non-governmental organizations, private actors, communities, as well as individuals who have interest in community. And 7 sub-committees are set up under this council, which are led by various ministries and agencies, as well as Health, Ministry of Health, Department of Social Welfare, Education and Spirituality, Ministry of Education, Ministry of Housing and Local Government, Ministry of Public Affairs, Ministry of Human Resources, as well as Ministry of Science, Technology and Innovation of and consultancies approved with relevant stakeholders such as federal and state government, other government agencies, academic and civil and the private sector. Sharing findings and receiving updates from the ground network of National Advisory and Consultative Council for the Older Persons also meet at least twice a year and is chaired by the Ministry of Here, I bring in 3 dimensions of support for the elderly, especially during the pandemic COVID-19. The first is about the government, second is private, and the third one is about charity. The policy strategies to achieve enabling a supportive environment for all the adults, including strengthening the human governance and the enforcement of laws pertaining to all the adults, accessibility and capacity building of organizations, and intergenerational independence through intersectoral and multidisciplinary approach involving various governments, ministries and agencies, non-governmental organizations, private sector, and also the community. Expanding on these 3-dimensional support approach, I would like to introduce our very own activity sector as best known as Club Vengeance and
Within Power, the main
aim is to encourage the community and non-government engagement in senior care. In budget 2021, the government has dedicated annual financial aid for each power or elderly center activity from 53,360 ringgit per year or 8,000 United States to 50,000 or 12,000 United States. This aid is program and activity implementation in line with the concept of active and productive. This year, the government dedicating about 7.50 million to support the operation of 143 the elderly center activities as measured one. Apart from community-based programs, Malaysia also concentrates on institutional care. These institutional cares are designed to assist the less privileged persons in all daily life and functions. Example, we have activities provided into the structured and daily routine, rehabilitation, support, and guidance, recreational activities, and healthcare of treatment. Currently, we have centers for active, or we call it in Malaysia, it's a Rumah Street Pendapat and financed by the government. We also have 2 homes for chronically ill, called Rumah Ehsan and financed as well as by the government. And we also have 389 centers run by non-government organizations and private businesses under the care centers at 1993. are many issues that need to be addressed recently in the context of rapid structural changes in the Malaysian society and economy, especially during a pandemic COVID-19. Government acknowledges the gravity of the special expectations of our older persons and is committed to ensure our positive results and appreciation. Continue to embrace the following areas. First, in terms of human rights and empowerment, the second one of the participation in the community, the third one is about independent living, the fourth is strengthening family values, the fifth one is active, positive, and healthy aging, and last one is incentive to encourage birth. Our journey is long and serious, but it is also an exciting and hopeful moment for us. Malaysia stands at a crossroads that has faced many Asian nations before us. We endeavor to provide the best for our older persons who have been the backbone of the nation, and I'm sure all of you have gained an impact through this short sharing session on Malaysia. Thank you, and once again for inviting Malaysia to be a part of the session, and we look forward to learning what all of you think as well. Thank you very much.
감사합니다. 아주 그 심도 깊은
Thank you very much for your
발표해 주셨습니다. 파티마
in-depth
시미가님,
presentation. Thank you
발표
very much,
이후에 저희가 세부
Deputy
발표를
Director
듣고
General.
질의응답과
After
토론
taking
세션
all the presentations,
때까지
we
기다려
will have
주시기를
a Q&A
부탁드리고요.
session.
두
So please
번째
bear with us
발표로
till
곧이어
the end of the
넘어가도록
presentation.
하겠습니다.
Let me
두
move
번째
on to the second
발표는
presentation,
인도네시아의
which will
NGO인
be delivered by
야쿤이라고 하는
Director Sari
비상대책본부입니다.
Mutia
NGO
Timur of
이니셔티브에
Yakum
관련되어진
Emergency
지금
Unit of Indonesia,
우리가
which is an
말레이시아를
NGO.
통해서 정부의 이니셔티브에 관련되어지는
So the previous speaker
논의를
talked
쭉
about the
진행했다면
government
두
approaches,
번째에서는 어떻게
and the
NGO,
second speaker
시민사회가
will
이니셔티브를 가지고
share
논의
initiatives
문제에
led by
해결하는
civil
것인가,
society
이 여러 가지
regarding
재난이라든가 기후와 관련되어지는 문제에서
rights of human rights of older persons.
아이고 제가 타이머를
So I just set the timer so it alarmed. So sorry for this inconvenience. So next presenter is Director Sari Mutia Timur.
나와 계신가요?
Are you there, Miss Sari Mutia Timur?
티머 이사님,
We have Director Samuri Mutia Timur online.
오케이. 네네. 지금 아마 인터넷
Due to connection issues, maybe we need to postpone her presentation a bit more. So we have Professor Hong-Soo Kim next to me, so I'd like to ask her to present her presentation first. You have 20 minutes. Please go ahead.
Hi, hi everyone. I'm Hong-Soo Kim. It's a great honor and pleasure to have this opportunity to share South Korea's experience. And the title of my presentation is Protecting the Health and Well-being of Older People in the Era of Climate Change, Current Status and Future Agenda in Korea. This is the contents. And yeah, global aging is, we are all the expert on the topic, so I will not go in detail, but Asia, as you see, is a very the rapid population aging is going on in Asia. And it also vary by the income level of the countries. In South Korea in 2021, people aged 65 plus composed 17% about of the population in Korea. By 2040, older people aged 65 plus are expected to account for about 40% of whole population in Korea. And recent statistics from statistics in Korea, Korea will become the world's most aged society by 2067, and the working population is expected to fall to 45%. This is a detailed country profile in Korea, so I will not go in detail, but several statistics might be interesting to you. But one thing I want to mention is, as the moderator said, the life expectancy has been increased rapidly, but still there is a gap between men and women. And this slide shows the burden of chronic disease in Korea. So South Korean people living and enjoying the long, lengthy life, but they are still suffer various chronic diseases. And the other important social situation we have to concern is high poverty rate of older people in Korea. The poverty rate of the older people in Korea is the highest among OECD countries. The share of poor senior was about 44% compared with the OECD average of 15%. Another important social phenomenon recently got attention is the increase in single household in Korea. Percentage of older adults living alone is 16% in 2000, and it increased about 20% in 2020. Single person household registration is not only for older people, but whole Korean have hit a high of 40% for the first time. Middle-aged people in single person compared to multi-household people, and as expected, lower health and well-being conditions. In summary, under the rapid economic development over the last 40 years, South Korea has experienced increasing life expectancy, but also the society has experienced drastic social and demographic changes in family structure, disease burden, and it has come with high health and social inequality. Now all Koreans face another challenge by the change of physical environment as a form of climate change. So the pace of climate change in Korea has been and is predicted to continue to be faster than global average rate. And heat wave, which currently total 10 days a year, will increase more than threefold in 35.5 days by 2100. Sorry, there is a typo. And according to the recent abnormal climate report, also shows the climate change brought the high cost of property damage and causality. You will see the detailed statistic here. And especially for heat waves, the impact of health depends on socio-economic status, such as gender, age, health condition, income, education, and regional characteristics. Older women over 65 is very vulnerable, and also you see other lower level education and other factors all comes together. But as I presented earlier, Korean current older people and especially women have likely lower education and poor than older Korean men. So considering the high poverty rate and high disease burden in the later life of Korean men and women, especially women, vulnerable older people face multiple burdens and risks for more frequent and intense heat waves due to Korean climate change. Another interesting fact we have to consider is the climate change is unequally affected the lives of and well-being and human rights of older people. And one is the geographic variation in climate change, older people's health. The impact of the climate change on health depends on the regional physical environment and vulnerability of the social structure. Poor urban dwelling older Koreans are more likely to have higher multimorbidity and lower neighborhood social networks, so they are vulnerable or high risk by the change of climate. But also the total damage in rural area is smaller than in city likely, but the damage area per person and the damage caused per person are larger than in cities, according to recent statistics. And this slide also shows a map. It shows the geographic variation in the climate change and older people's health. This and next slide shows how heat wave related to mortality risk varied by area and subpopulation characteristics. And also, heat wave related mortality is higher in socially isolated city-dwelling older Koreans. In summary, the impact of climate change unequally affects older people in Korea due to their health and social vulnerability. In addition, the within variation in the vulnerability among older Koreans is another important point. It has huge implications for human rights policy for the later life of Korean. And now we move to the policy and service efforts to respond to the climate change for older people in Korea. Recently, the government released the third National Climate Change Adaptation Plan. It's a 5-year plan. It's the roadmap how we adopt the new social and physical challenge. And Korean government also recently announced the plan toward carbon neutrality. According to the national plan, Korea established KACCC, the Adaptation Center. It composed 3 teams: policy research team, adaptation cooperation team, and information and knowledge team. It involves 13 government departments, consists of 7 major sectors, including health and other sectors. The plan is to be adjusted, revised, complemented every 5 years. We also have principles for national climate change adaptation measures. There are several, but as you see in second, the principle indicate we have to consider of group vulnerability to climate change. And there are, because the very fast population aging, Korean government has various efforts to respond to population aging and try to protect their human rights. So here are several public policy areas for older people, but in that policy plan and proposal, you can see some climate change related component. For example, as for income support, it includes disaster recovery expenses they cover, government cover. For housing service, it supports for housing renovation for to respond to climate change. But no targeted and consolidated policies have not been well established. We also provide various public services for climate change. The listed items are measures to adopt for climate change with regarding older people. Especially for heat wave, we provide support for installation of air conditioner, implementation of environmental welfare service. We provide some counseling and guidance, and we also implemented and provide cool roof support for senior facility. For cold waves, similarly, we provide counseling and provide counseling related visit and cold wave heating impact survey. We operate cold wave shelter and support for heating cost. another point I would like to mention, South Korea is one of the countries very high-speed internet and cell phone penetration. We have high rates. All Korean, older people, about 98% have cell phone. So government and also private sector are very much interested about using this technology innovation to protect all the people in emergency situation. So you see here some approach or the pilot programs. And also recently, government and private come together and they do some AI-based emergency monitoring and emergency call services they provided. And Korean Telecom also implemented AI-based mobile health care. And now I move on what kind of lesson we can earn from international cases. For UK, it's the concern we have, the regional variation about the impact of climate change for older people. UK have already addressed that issue. So they implemented region-specific policy approach to adapt climate change. And UK also tried to engage all the people in policy effort for climate change adaptation. The strategy proposed by Stockholm Environment Institute have several very interesting points. I will not go all detail, but number one, abandon all stereotypes. Get to know your target audience. Use positive message, use the right frame, show real life example. These are all seem to be very effective strategy for engaging older people in CCA. We have to also consider this strategy to engage our older people in responding CCA. And also, this is US case. They try to promote health literacy and communication with older people on climate change adaptation issue. This is, I think, the last example, the Sharper project. This is an international project examined seasonal health variation and resilience in the urban older in London, New York, and Shanghai, and they addressed the exposure and vulnerability of aging population in the cities to extreme weather events, and has developed a new HVI for London. And they shows how we can increase the resilience of older people responding to the climate change, and how that approach can also benefit for increasing the resilience of the city. So the discussion. In summary, South Korea has experienced rapid population aging, and older people experience extended life expectancy with various health and social challenges. Various policy and services efforts have been actively implemented, yet health inequality is still a critical issue and significant impact the human rights of, in the later life of Koreans. Climate change is a real social risk in Korea now, and policy and service efforts has been also developed and implemented. Although older people are recognized as a high-risk group for the effects of climate change, policy and services for climate change adaptation do not yet target this group well, nor are these efforts well coordinated. So for future direction, I would like to suggest we have to establish more aging-sensitive CCA policies are needed. Population aging policy and climate change policies should be better aligned, which could have synergistic effect. Older person-centered CCA services should be provided. A more integrated service approaches for each older individual with complex health and social needs should be provided. We also need better understanding of the diversity of older people by their health status, health condition, and socio-economic status, and where they live. Better monitoring and evaluation system for the effect of CCA on older people's health and well-being are needed. And also, this is, I think, is important. So far, Korean CCA policy for older people is pretty much protection focused. They all identify older people are very vulnerable. It's somehow correct, but when we see the international experience, more engaged, focused approach seem to be needed and could be very effective. So we have to think about what's the optimal mix of top-down and bottom-up approach in the Korean context. We have to commit to build a healthy and sustainable community under climate change. The CCA policy should not only focus on individual person-based approach. You also have to build better, sustainable community and where older people live. National versus regional local policy plan has to be also be balanced and well organized. More engagement and participation of older people in CCA is imperative at this stage because South Korea has experienced very rapid social change. So current older generation and next older generation has somehow quite different needs and preference and way of living lifestyle. So we need strategy for strengthening the resilience of the Korean aging population by generation and gender by gender and various diversity in older population. And high potential for technology innovation in CCA, but better evidence through rigorous R&D is still very needed. Health and digital literacy of older Korean is a critical factor to make this happen. Just technology itself, focusing on technology development may not work. As I mentioned earlier, baby boomer and current older people different, so we need new generation, we need a new policy and service strategy. I think this is my last slide. Thank you for your attention.
Thank you, Professor Kim. You gave us a very comprehensive pictures how the climate change impact for the older generation, older population. So now we're going to invite the last speaker from the Indonesia, Yakum, Ms. Sari Mutia Timur. Are you here? Okay, can you hear me?
Yes, I can hear you.
Okay, welcome. So you have a floor now. Please present your presentation in 20 minutes.
And you can see my screen now?
Yes. Go ahead, please.
Okay.
Yes.
Yeah. So thank you for being invited to this important and interesting forum, and for the congratulations to the organizer on their effort to make this event. And this presentation will share about the problem of older people in Indonesia during disaster and then the next approach. I'm from Indonesia and work for NGO with the mandate for emergency response, disaster risk reduction, and climate change adaptation. So this is the problem of older person in Indonesia. First is economic problem. As you can see, there is decreased work productivity and limited job opportunities and lack of social security. And poverty is the biggest welfare threat for older people because of low income, poor health and nutrition, and reduced access to basic services. And second problem is health problem. There is decreased physical and mental abilities, This causes the need for health services increase, of course, because of there is degenerative diseases. And the third problem is social, resulting from changes in the life pattern, family system, social values, and neglect of victim of violence and social exclusion. And of course, poverty of children or family often causes the older people to be neglected. And usually, older people feel there is transition from working to retirement, and there is productivity decreases leads to income decreases, and physical condition decreases leads to health cost increase. And the swelling of older people make the older people is vulnerable to live in poverty, and of course will impact the quality of life and community resilience. And in Indonesia, we have a law related with right of older people. We have the right is have the same right in social, national, and state life, get religious and mental spiritual services, get health services, get job opportunities, and get education and training, and get convenience in the use of facilities, including public facilities and infrastructure, for example, shelter or camp, and convenience in legal services and assistance, and also get social protection and social assistance. And on October 2018, during Central Sulawesi disaster, we got support from Health Aids International to do a rapid need assessment for older people, which involved 325 participants. And as you can see the result, there is problem in privacy using public bathroom, and then there is problem also. The older people said the location of the public bathroom is far away. And top of the priority for older people, access to adequate food and safety when assessing humanitarian assistance from violence, including sexual, physical, and financial and emotional, including neglect. And more than third of respondents who had to take regular medication were cut off after the disaster, while 20% of the older people ran out medication less than 3 days. And older people are considered powerless and are not priority for recipient of economic assistance. And actually during the disaster responses, we also give several intervention for the older people. We give basic need and security activities, such as mobile clinic and distribute hygiene kit for older people, and accessibility audit in IDP camp. And for support the family and community, we have like gym activities and capacity building. With non-directed specialized, we have monthly meeting, of course, with health protocol, but in that time, there is no pandemic, which is involve health cadres in integrated health posts, monthly meeting, and older people can meet the specialists if needed. And learning from psychosocial support, is it important to conduct a need assessment for older people? Determine the type of support or care with in-depth discussion with older people and their family, of course, their caregivers, and discuss also various possibilities, including if there is possibility, if the older people's health will deteriorate. And training for cadres and health workers in dealing with older patients, especially those with dementia. Organizing older people to form groups of older people is step and tool that has a major influence in building resilience. So we call it, the group is intergenerational group. So we use intergenerational approach. ensure that the information conveyed is clear, and ensure also there is a channel that can be accessed by senior of older or older people to convey their input, their feedback, even their complaint on the services. And we also delivered health intervention, health sector intervention, such as distribution of special needs of older people, diapers, thermos or vacuum flasks, and health service outreach or home visit, cataract surgery, distribution of assistive device such as glasses, walker, tripod, or wheelchair, and also distribution simple medical equipment for older people in integrated health posts and in public health center. And also we help the process of making older people ID card. So actually we not only think about psychosocial, but also health, and also we provide inclusive and accessible toilet in shelter, and also accessible shelter, of course. And we should ensure the older people sleep in the comfortable place, not too low or not directly in the floor. And we also facilitate monthly meeting and facilitate ID card, because during disaster, sometimes older people lose their ID card and document, and even older people do not know they can use the ID card to access the assistance. And through Help Aids International, we also support and facilitate 550 older people in Central Sulawesi to rebuild their economy through older people-friendly economic activities, such as agriculture, animal husbandry, or open their small shops. And we give training to older people, the training such as asset-based community development. The aim is to facilitate business plan through identification of their potential or local resources and skill, and then they can submit the simple business proposal. And related with disaster preparedness, we give preparedness training involve older people. Since during disaster, usually older people confuse where the assembly point, where the evacuation road or evacuation post, and in the shelter. That's why the disaster preparedness is important for older people. So older people can evacuate independently, and we can provide proper assistance in the disaster. Yeah, we also form older people association in assisted villages. This forum aims to empower older people to become healthy, resilient, and independent through health promotion, service activities, home care, skill improvement, and socio-economic assistance. So what's the next? Because the number of older people in Indonesia is increasing, and also the number of the disaster. So we think about inclusion approach. So inclusion is a comprehensive process that brings about changes in approaches, structures, and strategies in providing assistance and protection to overcome barriers, with the aim of providing the best learning experiences and environment that are fair and participatory. So inclusion is not the same with exclusion, of course, segregation and integration. So inclusion is the process by which everyone, regardless of age, disability, gender, religion, sexual preference, or nationality, can access and participate fully in all activities or service. Inclusion addresses dignity, opportunity, and accommodation. Inclusion also is about changing society to accommodate differences and to combat the discrimination. So that's why inclusion means right-based approach, which aim to ensure the older person, also people with disabilities and others with special needs, have equal access to basic services and have voice in the development, not only in humanitarian crisis and implementation of the project. And all organizations need to make effort to overcome and remove the barrier. So this inclusion principle, of course, we should ensure that everyone is involved in all stages of the program of or project, and identify and understand the social, economic, environmental, and power dynamic that contribute to exclusion and who is excluded as a result. And be alert, question and challenge social norm, attitude and institution, and remove barrier and create an enabling environment for the implementation of inclusive program. To no harm, of course, we should consider all the possible effects, positive and negative, of the project or program. Monitor and learn, monitor, review and learn. So related with data collection, know who does and does not benefit from humanitarian services, avoid assumption, discrimination, and exclusion. So the key principle of inclusive programs, we should identify who the excluded people are, remove barrier to inclusion, build the capacity of marginalized groups to have their voice heard, recognize the inequality and power dynamic, use participatory approach to engage them, ensure older people association and also disability people organization, and of course community-based organization are involved. Monitor who gets and does not benefit from the humanitarian services provided. And yeah, there is a standard who can give us guidance about humanitarian inclusion. That is humanitarian inclusion standard. Humanitarian inclusion standard will help organizations address the critical issue of how to include those most at risk during an emergency and prevent anyone from being left behind. Provide guidance to practitioners and organizations with action that need to be taken to protect, support, and involve older people and people with disabilities. There are guidelines for identifying and overcome barriers to participation and access in various contexts and across program cycles. This standard represents an important step to promote and improve action to meet the needs. So in this standard, there is 9 inclusion standards. Number 1 is identification. Older people are identified to ensure they can access assistance and protection in participatory, appropriate, and relevant manner. So, for example, we provide this aggregated data collection by gender, age, disability, type of disability, and ensure and improve, and of course utilize the updated aggregated data, start from the local to the national level in the implementation and monitoring with respect to the data protection. Key inclusion number 2 is safe and fair access. Older people have safe and equal access to assistance and protection. For example, we provide inclusive health services, conducting training for cadres, for example, measuring vital signs so they can do it mobile, and availability of assistive devices such as wheelchairs. Key inclusion standard number 3, resilient. Older people are less negatively affected and more prepared and resilient, and less at risk after receiving assistance humanity. For example, older people on people with disabilities and other vulnerable people who are at risk related to protection have access to protection services and are protected from the risk of physical and psychological threat. There is psychological first aid training for initial psychological support for people. The inclusion number 4 related with the knowledge and participation. Older people know their right and participate in decisions that affect their life. For example, during developing the contingency plan, will attended by representative of older people, people with disabilities, children, transgender, women, and other risk group in the village. And key inclusion number 5 related with feedback and complaint. So older people can have access to safe and responsive feedback and accessible complaint mechanism. So then they can give feedback on facilities, infrastructure, or during preparation on inclusive shelter or camp. And also they have dignified to access the water supply, sanitation facilities, hygiene promotion activities, and make sure the early warning or shelter can be accessed by the deaf, the blind, using the, for example, emergency light, and also make sure there is accessibility audit. The inclusion number 6 related with coordination. Older people have access to and participate in coordinated and complementary humanitarian assistance. For example, during provide healthy nutrition, older people, people with disabilities, and other vulnerable have access to nutrition services and facilities and collaborated with the public kitchen volunteers to have understanding about balanced nutrition. And key inclusion number 7 about learning. Organization can collect and apply lessons learned to provide more inclusive assistance. For example, related to education and information dissemination, not only staff, but also older people, people with disabilities, and other most at-risk group can join, can attend the capacity building activities. And also we provide appropriate reasonable accommodations, such as sign language interpreter, accessible meeting room, provide transportation for participants. And information material also adjusted according to the type of barriers. And especially in camp or shelter, maybe we can think about the announcement uses running text and also provide accessible feedback mechanism. And in livelihood activities, older people can have access to the livelihood activities. And key inclusion number 8, related human resources. Staff and volunteers have appropriate skill and attitudes to implement the inclusive humanitarian action. And they also, the older people and persons with disabilities, have equal opportunities to work and apply as volunteer in humanitarian organization. And the last, the key inclusion number 9, management resources. Older people and people with disabilities can expect the humanitarian organization manage resources in a way that promotes inclusion. For example, establish age-friendly policy and budgeting. Yeah, so we need to have collaboration start from not only from local level, but also national, regional, and global level. And we also need to emphasize the importance of information management, which is when we disseminate the information, we make sure we use various communication channels. For example, direct socialization, WhatsApp group, door-to-door, and poster of leaflet. And we also have reporting both internally in YEU and also with relevant stakeholder, with government, with the ministry or agency. And we also should document and follow up the response and complaint received. So we should think about cross-sector issues, not only health sector, which is we also think about care management, cash transfer program access, fulfillment of the right, and capacity building. So the last slide, we just emphasize the detailed data identification needs to be done because so far the data in community sometimes has not been updated, utilized, even there is no disaggregated data. And we should ensure there is participation of most at-risk group in every policy making and planning. And accessibility audit conducted before a disaster occurs so that input from the risk group can be accommodated. And documenting lessons learned in handling the disaster response so that it can be passed down from generation to generation and become disaster literacy. That's my presentation. Thank you.
Thank you so much. Thank you so much, Director Timo. So it's a really, really marvelous information. So I learned a lot from, the Yakum's experience. So now we open the floor for the question and answer session. So if there is no question from the internet and the floor, I'll give the 3 questions for each speakers. So Ms. Fatima, you wait for a long time. So there's one question, so it's the initial questions for you. The philosophy of the national policy on older persons seems to be based on a human rights-based approach to older population. It is uncommon to find the human rights-based approach to older population, particularly in the government, the policies for middle-income countries like Malaysia and other Asian countries. So for instance, many countries, including the Korean government, so Professor Kim already mentioned about that, so tend to prioritize the expansion of welfare services in their policies for older persons rather than seeing them as an agencies with the right to dignity. Could you explain how and why the Malaysian government adopt the human rights-centered national policy for older persons? How is this reflected in the Malaysian government responses to the needs of older persons in climate change and natural disasters? So now you have a microphone.
Madam Chair, can you hear me?
Yes, I can hear you.
Okay, thank
Please
you.
Go ahead.
Thank you very much. Yeah, thank you very much for the question. I really appreciate that, and thank you for person who asked about that. Yeah, Malaysia, one of the philosophy that I mentioned just now is about one of the core pillar to adopt the philosophy on Malaysian national policy for all the person is about human rights. Why we Malaysian really encourage on that part? Because we believe that all the person we have to treat them same with others, right? So they also Malaysian citizens, they have the rights, and the most important things in Malaysia, nobody left behind. So this part's on a national policy for all the person which is developed on 2011. So now we are in process to review that because we are going to have in-line or highlighted similar under the 12th Malaysia Plan, which is under 12th Malaysia Plan, we are highlighted in terms of inclusivity and also the equality of the persons in Malaysia. So the impact of the national policy for all the persons in terms of human rights is the first thing, all the person, we work together. We are in process to encourage all the elderly to be together with the nation, develop the countries. And for your information, right now, under the new Prime Minister Malaysia, we come out with the one tagline: we are family or Malaysian family, or in Malay is about Keluarga Malaysia. So with this tagline, we believe that all the persons, all citizens in Malaysia, we work together to develop the country, especially after we are facing the pandemic COVID-19. And I would like also to highlight, in terms of national policy for all the person, we also have the plan of action for all the person, and I believe there's good same things in Korea and other countries, which is on all the person and national policy for all the person. The first important things is about the development of humans itself, human rights, right? The first objective of the national policy for all the persons is to develop a caring society. This is the most pillar that we believe, how to develop and to encourage all the persons to work together with the governments and to set up and to build our country. And as well, I also would like to highlight on the capacity building of the society to face the aging phenomena, which is faced all over the world, and also to mainstreaming aging in the nation developmental agenda, and address is one of the strategies in the plan of actions. I think I answered the questions. Right. Thank you, Madam Chair.
Thank you so much. So the government led, the national policies for the older persons. Actually, the Malaysian government tried to focus on the older person based on the human rights. So that's a very, much important point for the experience of Malaysian government. So I'll give this, question for the second speaker, Professor Kim. So you explain about the climate change adaptation, how it impacts for the government policy for the older population. So while climate change can have immense impact on older people's health, linking these two things are not commonly understood yet. So it seems quite impressive to see that the Korean government addressed the needs of older persons in the context of climate change, and it disproportionately impact on older persons, and particularly among older persons in more vulnerable conditions, such as those living alone, etc. So can you tell us how importantly the protection of older persons in climate change is considered amongst the government officials and policymakers, the legislature? For example, in Korea, are there any plans for a large-scale investments in these areas?
Yes, Chairman. I think it's an interesting question and important. And I think the climate change and population aging both well recognize the high risk of the society. But as I mentioned in my presentation earlier, the level what we have been now is they are vulnerable. Just we are aware of it, but we can move more forward. But as I mentioned, their physical and social vulnerability, because in the very fast social development, the current older people have limited financial protection, and their health is also much vulnerable than younger. So we have to go beyond the identify their vulnerability. We have to more consolidated action plan how to protect age sensitive, how older people's own needs, how they can be reflected in climate change adaptation plan. And I think, in the recent national plan, the 5-year plan, in that plan, it is also include and identify clearly the older people and also women as a vulnerable group. So the efforts has been continued, but somehow we need a jump of a new perspective, how to incorporate in their own perspective, because the protection has to be the key message how we deal with aging and climate change together in Korean policy document. That's basically true, but in more other countries' experience, I think engagement and other aspects, we have to understand all the people's view and have to better knowledge and information and make a real action to make our plan move to the next stage, I think. Yeah, thank you.
Thank you. Thank you so much. I will, give the more questions after the, speaker, Ms. Timor, the question. I will give you the question. It is really very interesting. When the tsunami occurred in the year of 2004, one of my friends actually immediately go back to Indonesia, to Yogyakarta, to help her, relatives and her, community, members. So I was so touched and impressed at that time. So the natural disaster issue in Indonesia, I think it's very, very much important and, critical and, issues. So it is really interesting to see the Yakum emergency. I really want to know about what is the Yakum project itself, basically. So I think you better to explain more about the Yakum itself after I give my questions. So the Yakum Emergency Unit works to articulate initiative to build community resilience through community-led disaster risk reduction and climate change adaptation. This appears to be the movement from below to empower all the person's ability to respond to climate change and natural disaster. What is the relation between, YEU and the government? Is the work of YEU complementary to the government or filling the gap that the government does not provide? What is the key benefit of build community-led disaster risk reduction in the opposition to other government-led initiatives, and how have all the persons received YEU's initiatives? Can you share examples and case where the community-based disaster risk reduction work well in an emergency situation? So please start from the explaining more, information of the Yakum, NGO, initiatives.
Yeah, thank you. Yakum Emergency, as I said, Yakum Emergency Unit is an NGO based in Yogyakarta, actually. Like I said, we have mandate in emergency response and disaster risk reduction and climate change adaptation. Of course, we already registered under government, and our role is also like complementary and fill the gap with the government. So during disaster risk reduction, we also hand in hand with government to make sure all the most at-risk group have equal access and can involve and participate. So yeah, we established since 2001 actually. So yeah, during Yogyakarta earthquake, actually I still in Aceh because we have another disaster also before. Yeah, so related with your question about government, like I said, we are not competitor. We agree, we support the government, we fill the gap. For example, during disaster, maybe the first time of disaster, the health system is collapsed. So we provide mobile clinic. But then during the health system of government already started, we close our mobile clinic, but we will have a home visit because sometimes like older people, bedridden person, and people with disability who have a limited mobility, they have difficulty to access the health services of government. But then we provide, for example, training and capacity building for health cadre, including the government. That's why, because of course, where you not always stay in the area of disaster. So we give capacity building for cadre and the family and caregiver, and include the government to how handling the people with disability, older people. For example, like I said, we provide the simple medical equipment, and we also train the cadre how to monitor the vital sign. Include also for example, we train the cadre with first aid training, because in remote area, we have so many remote area. Actually, the community is the first responder, so they understand how to help the person first help the person before they get a fixed clinic or reliable assistance. That's why actually we collaborate the community and the health also. We have we call it diamond approach. For example, the first step is give training the community. For example, medical first aid and the livelihood. So give training, we increase the knowledge and skill. And then the second step, we will give a small stimulant, just small fund. So let the community practice to use the small grant to practice their knowledge, to practice their plan. For example, when they develop the contingency plan, they of course they have plan and then they practice. And then the second step, they will link the community to the government or relevant stakeholder, even the public sector and another relevant stakeholder. And then the last step, since they have knowledge and skill, they have confidence because they already practice, and we link it to the relevant stakeholder. The people, the older people with disability, even women can have confidence and can join and participate in decision-making meeting, because of course, where you not always in the area, for example, in Aceh, we not always stay in Aceh, but we will give training and legacy for the community. That's it.
Thank you so much for all the deep knowledge and experience-based information. So I give a second floor question for all three speakers in the same questions about the gender perspective. How do you distinguish how do you collect, how do you collect and assess the women's and men's different needs and interests and priorities? So when you design your national strategy, for example, the Malaysian government, and when you design and implementing the program and project in Yakum project in the community-based activities, and the national strategies and new plans for the climate adaptation based new strategy. How do you actually assess the gender standpoint? So please provide if you have an initiative already you got, or if you have a plan for the future, please feel free to provide any information for us. So I think Ms. Salehu, you can start first.
Thank you, Madam Chair. Right. Okay, in terms of gender perspective, this is a very good question. So I really like it. Okay. In Malaysia, we have first, it's about the gender budgeting. The gender budgeting. In terms of budget, and in Malaysia, this Friday, the government will announce the national budget, right? So when we did the budget, so we are really concerned about the gender budgeting. As long as for the older person, what we are care is about how, the first important thing is the rights of the older persons, right? So based on that, we are doing mapping and then do a research to ensure that the older person, we know their rights and the equality, right, between the older women elderlies and as well as men elderlies. That's the first thing. The second one is about the accessibility, right? We know the accessibility for the older person is different, and the difference we have to look between gender, you know. Maybe men and women, we need the same accessibility, but in terms of degree of the accessibility, I believe that is different. So based on that, we in Malaysia, we are highlighted in terms of universal design, no? Universal design to ensure that all the elder persons, especially in the of a gender perspective, they have their own rights and they will feel and they enjoy all the facilities that is providing either by the government or others party. So this is what we are thinking about the gender perspective, especially for older person, as well as during disaster. We also come out one special standard operating procedure to cover or to entertain the older person during disaster. That means older persons, men, older persons and women, older persons, they have a different treatment, right? Because we are going to ensure that during the disaster, they're healthy, they are conducive, their situations, they are well taken care. So this is what we are talking about gender perspective. And for the next, for future, and this is the way forward, that under the 12 Malaysia plans as well in the Malaysia, we also highlighted one topic for the gender perspective, because we are going to take care the conduciveness and the what we call it, the well-being of the elderly. I think that's I would like to highlight on this conference. Thank you, Madam Chair.
Okay, for Korea case.
Yes.
Yeah.
Yes, please
okay.
go ahead.
Yeah, okay. So we, under the leadership of Ministry of Gender Equality and Family, we have been various efforts to make gender mainstream happen. So in around 2009, Gender Equity Index has been released, and the data to make the index and the result has been released periodically, and the gender index, equity index is at national level and by region. And also around 2010, the gender statistics information system has been also established. So Statistics Korea have been developed and produced various gender-specific, gender-specific data in various ways to make the decision, the policy level and system implementation level. And also the National Climate Change Adaptation Plan also clearly mentioned the gender-specific approach needed, and they gather data by gender, by male and female. But I think we have to think about what kind of data that the contents really need, and especially in gender in older people. And the knowledge, the unique knowledge and information and wisdom has to be we have to think of further, and the just dividing number by male and female, that's what we can do and we are trying to do, and we pretty much in consensus. But to really react and make the better resilience of older people and community level resilience to to respond to the new challenge, the climate change, we have the more sophisticated system and something more action-oriented data and information, I think, are very much needed at this point. Thank you.
Thank you so much. And Ms. Timmer.
Yeah. So, from some literature said that the number of older women over 80 years is 2 times more than older men. So yeah, we should think about a gender program, but actually we start with the simple because we're still learning ourselves. Like we are planning to have gender age marker next year or next month maybe. Meanwhile, we are doing is ensuring that their need and the expectation can be identified to rapid need assessment and involve the women and men also in during meeting, and ensure they also can give input, even the complaint, and involve during implementation, such as involved in a special task force for disaster, because older people, men and women, have experience, and also make sure they also involved in monitoring and evaluation. And if there is an opportunity, we will encourage the older people to talk about themselves, about their achievement, their expectation and challenges. And we are, as an NGO, only facilitate, for example, only translate it. Like tomorrow, we have also share and learning in regional level. So I, together with with the community, the older women, and we will have the translation. And actually, we also don't have experience to deal with the transgender or elderly, senior transgender. So we're still learning about the gender program.
Thank you so much. So I think for already the Ms. Saleh who mentioned about the universality, the principle of universality. So about the principle of universality, to go to the universality, we need to check whether the equality, substantive equality, whether the substantive equality guaranteed and provided for the government policies as well as the community-based all the program and project. In that sense, I think the non-discrimination and substantive equality principles is based on the human rights approaches. So how the providers of all the services, whether it's a government side or it's NGO side or community-led, the programs, so how we learn and how we build the capacity. So these non-discrimination and substantive equality-based, universal, principles as a capacity and capability of the provider side. I think this is very much important, stage at this moment. Everything's changed rapidly, and especially the climate. It's not a climate change anymore; it's a climate crisis. It's in a global level. So it goes beyond the national borders and territories. So how we can work together to build our capacity to deal with this, very critical issue of the climate change and natural disaster, to solve these issues. So please, give your experience and your knowledge-based feedback. So I will go round same round. So Ms. Saleha, you can start first. Yeah.
Thank you, Madam Chair. Again, I would like to highlight in terms of universal design that I mentioned the previous one, right? So in terms of Malaysia, we have a special committee on this, right? To ensure that all the universal design, it was implemented to all, especially to all nations in Malaysia, to all districts, and as well as to all states. Right? We have 15 states in Malaysia and around 158 districts in Malaysia. So we have a special task force, right? And this task force was appointed at every local authority to empower these standards, especially when we provide disaster center for those victims who are involved in the disaster. So this committee will do a monitoring and empowering, and also they did the capacity buildings for the community. So especially now we are in October. In Malaysia, when October, November, and December, this is more on what we call it, the weather is different. So this is a heavy rain, right, in Malaysia right now. So all of us was preparing on to prepare in terms of disaster, especially for the flood, right? So during the preparation for flood, so all the local authority has already completed the train and the capacity building, how to handle the disaster victim. So based on that, all the capacity, all the facilities, especially on governments and the non-government, we work together. We already have a training, we have comprehensive training, how to manage and how to handle all disasters during this, what we call it, monsoon right now, on October, December, and November. And the other part, why in Malaysia this is a little bit, right, I can say this is a very successful, because we also both government, in terms of state government and also the federal government, we are support all these teams, especially the task force, in terms of provider the financial aid, right? Because we believe in terms of doing of training, they need lots of money to do this, and to encourage all the community to work together and understand what is the procedures, the rules and regulations during the project, right? So the other one, I would like also to highlight in terms of government support, right? We really happy because in terms of the practice of universal design for the elderly, the government, especially the federal government, we really support on this. And as well, we also come out with special guidelines for those who are really to empower and to practice the universal design. And as well, I would like to highlight also what I mentioned before on the national policy for elderly. This is one chapter on the universal design to highlight to all the committee's members at the community for them to understand. And we also encourage peer group to be one of the indicator to implement and to spread this information. So I think that's what I like to highlight. Thank you, Madam Chair.
Yeah, I think the participatory approach is very much important, point from the Malaysian, experience. So let's give the floor to the Professor Kim.
Okay. Yeah, the question is really the important one, but very challenging question. What you say is the equity principle or human rights principle is pretty well, somehow we can say, documented in paper or plan, but it's not well translated in real life of all the people. And also you specifically ask about the provider side issue. And especially this, the COVID situation is actually brought that issue, and provider used to be considered they have to be more sensitive about providing better care and better education, better awareness. That discussion and comments are still relevant. But the other side, recently, the provider side, or the provider and health and social care organization, people are also very much exhausted. They have also very limited budget. They spend their whole time in preventing and protecting people. So, and think about the two sides. It's not opponent. We have to all think together what's going on here and how we make the real change happen. And relate this issue, I think recently, yeah, you probably all know the GDP, especially for this Asia country, likely different the European and Western countries, some economic development somehow much well be done. But in our case, we have to deal with both economic development and welfare development. And now we have to think about how to make the balance better. So GDP is clearly, and we cannot pass that away, but what's the well-being economy somehow, how we make the balance, how we invest our precious resource to make people's well-being going on, and at the same time think about economic development. So, and how we can do, is another different question, how that make happen. And I don't have the clear question, but civil society might work more, and not only civil society, we have to better way to work together, like academician and NGO, civil society, and have better suggestion and better voice, all the people, and we all get together to make government to make a better policy. We can work together in that way. Thank you.
Yeah. So, during the presentation session, you already, all the speakers mentioned about government and NGO and private sector, partnerships. So I think the partnership and governments, especially between the government and NGO, is very much important thing. So, so the last, speakers, Ms. Timo. So you have a floor now.
Yeah. Actually, we work in two ways, not only bottom up, but also top down. So we are involved in government cluster related on most at-risk group. So we advocate and encourage the government to pay attention of the need of vulnerable groups, including about universal design. But also, on the other hand, we also increase the capacity and skill of the community. So they not only wait and passive. So, for example, we providing training for carpenter when how to build the safe, healthy, and accessible building. So they can build the building with minimal material they can find after disaster, and also with support from government, also they can implement the technique how to build the safe, healthy, and accessible houses. And yeah, so they know how to apply universal design and make sure that all communities have equal access. And I agree, this collaboration not only between government and NGO, but also, of course, will involve the academician, the university, and also the private sector. That's it.
Thank you so much to all the speakers. So I think it's almost time, on. So it's a time to close. So before I close the session, so as a facilitator of this session, I don't have any more point to add. So I really want to learn from you more and more. So I'm really feel sorry. So we have a time limitation. So each speaker has 1 minute closing session. I hope to start from the Professor Tim first, because you always speak last time. So please
Yeah, I think this gathering under COVID pandemic is going on is very meaningful and important, and I hope this initiative will go further beyond this symposium. Thank you.
Yes, Ms. Salehu.
Thank you, Madam Chair, and as well as all my colleagues, all the panelists. Thank you very much. This is very good. And I also learned lots from both of the panels here. So this is a very good program, and I really hope this ASEM will continue, and as well as this is a very good platform for all of us to learn the best practices from others. And on behalf of Malaysia government, I would like to highlight in terms of national elderly in Malaysia, we are really care all of them, and we really believe that in terms of human rights, this is the pillar of the development and as well as the well-being of the elderly. So thank you very much.
Thank you so much. So Ms. Timo.
Yeah. An inclusive approach in which older people are also given a role to be involved and provide input. So not only as a passive beneficiaries, at all level and in every disaster cycle and also development. And we should make sure ensure the older people get their right and the need according their condition. Thank you.
Thank you for all three speakers. It's a really, really valuable session, and I learned a lot from all of you. So the session 3, the older persons in climate change and natural disaster, it's a time to close this session. Thank you so much for all the audience from the online, especially for the online. The connection sometimes is not so good, so I really appreciate your patience and your enthusiasm to keep on listen and participate of this session. Thank you so much for everyone. So I'll give microphone to the moderator. Yeah.
Yes, thank you very much once again, everyone. Of course, there might be some technical difficulties. However, as the discussion goes on, welcoming all the experts from the organizations, also from the academia, I believe this will, of course, serve as a milestone in order to enhance the human right of the older persons. So once again, thank you very much, Ms. Saleh and Director Timur, Dr. Kim, and also Dr. Cho for moderating the session. This is the end of the third session, and before we move on to the last session, we are going to have a break in order for you to digest what we have learned. And we will be back at 4:30 Korean Standard Time at the last session. So we'll see you all once again at 4:30. Thank you very much. Well, participants from all around the globe, I hope you're well rested and are ready for our last session. Well, the last session here at ASEM Forum on Human Rights of Older Persons is conducted with World Health Organization under the topic of Older Persons in Emergencies and Ageism. Dr. Choi Sung-jae, Professor Emeritus of Seoul National University, will join the session as the moderator, and Dr. Chung Sun-dul will be joining us as the panelist on stage. And now let me pass on the mic to our moderator. Dr. Choi Sung-jae, please.
Yes. Good afternoon, ladies and gentlemen, and distinguished guests. My name is Sung-jae Choi, Professor Emeritus at the Department of Seoul National University. I am very glad to be a moderator on this last session of this important forum of human rights for the older persons. As a moderator on this session's forum, I sincerely welcome all of you to this session and hope you will actively participate in our presentation and discussions, staying with us to the end of this session. As you may know, in last March, World Health Organization issued the global report on ageism. Yeah, first of all, I and all of you as participants and may have to congratulations WHO on the publication of the global report of ageism. The report seems to be very distinctive in many respects. And I'm sure this report will contribute to facilitating research studies and combating ageism in our aging society. This session has prepared in commemoration of publication of World Health Organization's global report on ageism and its Korean version. May have your Korean audience have these copies here already, and this is English copies that was published in March this year, and also reflecting lessons from the experience of emergent situations such as pandemic, coronavirus disease, and this session has been organized with World Health Organization. Before starting this session, I would like to briefly introduce the speaker, Dr. Vinia de la Fuente Nunez. I'm not good at speaking and pronunciation in Spanish. Dr. Fuente Nunez is originally from Spain, and she is a technical officer at the World Health Organization. She joined WHO in 2014. She managed the global campaign of combat ageism at WHO and lead authors of the global report on ageism. This report, she is a lead author of this report. She is a medical doctor and a public health expert with extensive experience working with international organizations, research institutions, and NGOs in the area of aging, ageism, and epidemics and outbreaks, and health research and development. She is multi-language speaker of English, Spanish, French, and German. Yes, she's very, excellent and multi-language speaker. Now, we're going to enjoy what he is going to speak as a, speaker of this session. And Dr. Fuente Nunez, are you here?
Yes.
Yes.
Can you hear me?
Okay, thank you very much. All right, okay. Would you please start your presentation?
Yes, thank you very much, Professor Choi Seng-jo. I hope I pronounced your name correctly. I'm also unfortunately not a fluent speaker of Korean, so I probably mispronounced your name, so I apologize for that. It's a great pleasure really to be here today and to commemorate, as you were saying, the translation of the full global report on ageism into Korean. This is the first full translation of the report that we have available, and we're very grateful to the ASEM Global Aging Center for helping with this translation that will hopefully help disseminate the report even further. I'm going to start by trying to share my slides, which hopefully you will be able to see full screen. In just a second. Can you see this? I think you can see the slides, yeah? All right, so before I get started, I wanted to go over the agenda or the structure of this presentation for today. And what I plan to do in the next few minutes is to first give you a little bit of context with regards to demographics and also how older people are affected in emergencies. This will be followed by explaining what ageism is. Then we will go into where we see ageism, and then I will delve into how it affects us, which can respond to that question as to why should we care about ageism. And I will end the presentation by explaining what we can do about it. Hopefully, this will spark interest and actions to combat ageism in emergencies and also beyond. So let us get started with the context. The demographic structure of our societies is changing, as we all know, with populations aging across countries. What you see in this slide is the progressive increase in the percentage of people aged 60 years or older across the world. And you see that the years are changing as I click on the slides. What we also see in this slide is that population aging is relevant to every country. By 2050, 80% of all older people will live in low and middle income countries. We also know that the pace of population aging in many countries is also much faster than has been the case in the past. For example, while France had almost 150 years to adapt to a change from 10% to 20% in the proportion of the population that was older than 60 years, places such as Brazil and India will have slightly more than 20 years to make that same adaptation. We also know that older people are increasingly affected by emergencies, including natural disasters and conflicts. For example, we see that in 2020, 12.3% of the population living in fragile countries were 50 or over. This percentage will increase to 19.2% by 2050. And we know that fragile countries are those where conflict and disasters are more likely to occur. As a percentage of the total population, older people also have the highest death rate of any age group in the context of emergencies. And this is reflected also in the figure that you see on the slide, which comes from the Global Report on Ageism. For example, in the Philippines in 2013, people over 60 represented approximately 7% of the population, and yet accounted for 38% of the fatalities caused by the typhoon Haiyan that same year. We see similar figures in Nepal, where 29% of people who died in the earthquake in 2015 were aged over 60, while older people only represented 88% of the population. In the 2011 Great East Japan earthquake, 56% of those who died were 65 years and older, despite constituting only 23% of the population. More recently, we saw that the vast majority of people who died in Australian bushfires in 2020, apart from those directly involved in the firefighting effort, were over 60. And of course, I think all of the attendees here today would know that in the context of the ongoing COVID-19 pandemic, global evidence has shown that older people face a significantly higher case fatality rate from this disease than people in younger age groups. The case fatality rate of COVID-19 is also increased in those with underlying conditions that affect the immune, cardiovascular, and respiratory systems. And these conditions, we know, are more common in older age. We have figures that show that in many countries, more than 40% of deaths related to COVID-19 were linked to long-term care facilities, with figures being as high as 80% in these facilities in some high-income countries. Unfortunately, ageism is standing in the way of effective responses to emergencies. But before I explain how ageism manifests in the context of emergencies, let me start by explaining what we mean by ageism. When we talk about ageism, what we're really talking about is how we think, how we feel, and how we act towards other people or towards ourselves based on age. This means that when we talk about ageism, we're really referring to three distinct dimensions: stereotypes, prejudice, and discrimination, which are mutually reinforcing. This means that if I have prejudice towards someone on the basis of their age, this can lead to me having discriminatory actions toward a person. In the same way, if I display discriminatory actions towards another person, this can also affect the way that I think about that person. Something else that I also wanted to flag in this slide is that ageism starts very early in life and is then reinforced over time. Children as young as 4 are already very aware of their own culture's age stereotypes, and they internalize these stereotypes and use them to guide their feelings and behavior towards people of different ages, and also towards themselves. If we are repeatedly exposed to stereotypes about older people, for example, we will eventually start using them to guide our interactions with older people when we're younger, and once we reach old age, these can become self-stereotypes, affecting what we do or what we don't do or how we perform in specific tasks. Stereotypes can be particularly salient in the context of emergencies, where older people tend to be considered as a homogeneous group of frail and vulnerable people and treated as such. This can result, as I was explaining, in older people also internalizing these stereotypes and using them against themselves, limiting their performance or their willingness to engage in certain activities that are not deemed appropriate for older people. What we also see in the report is that ageism is everywhere. It is in our institutions, in our relationships, and in ourselves. Institutional ageism refers to the ageism that we see in social norms, in practices, in laws that regulate institutions, and that systematically disadvantage people on the basis of their age, affecting, for example, the resources that they have access to or the services. We see examples of institutional ageism in healthcare and social care. We see it also in employment, in the media, in housing, again, in most of the institutions that we can think of. Interpersonal ageism refers to that ageism that we see in interactions between 2 or more people. Examples of interpersonal ageism can include, for example, patronizing or disregarding the views and the ideas of older or younger people on the basis of their age, or not allowing them to make decisions for themselves when they have the capacity to do so. And finally, self-directed ageism refers to that ageism that we direct towards ourselves and is the result of that process of internalization of stereotypes through our lifetime, which we eventually then use as self-stereotypes. The report shows that 1 in 2 people are ageist against older people, with rates much higher in low and lower middle income countries, as you see reflected on this slide. This means that half of the world's population has moderate or highly ageist attitudes against older people. Just think about this. This means that either you or the person sitting next to you would have those ageist attitudes against older people. As I was mentioning, ageism is everywhere, and we are all raised in ageist societies. So it's an ism that is normalized and socially accepted. With regards to ageism against younger people, here, unfortunately, we don't have global prevalence data, but we do have data from Europe, which is the only region which has information about the prevalence of ageism against all age groups. And in this region, younger people report more ageism than other age groups. The one that follows is older people, also in this region. As I mentioned, ageism is everywhere, and this includes emergency settings. Despite the figures that I mentioned at the beginning with regards to the fatality rates in emergencies, older people are often neglected or not given due attention in the context of emergencies. They can be excluded from official data systems. For example, in the context of the pandemic, older age groups were frequently excluded from COVID-19 official data systems or are not visible within them. And where data on older age groups is collected, disaggregated data is often not reported or made publicly available. Just think about the amount of time it took for us to get information regarding the case fatality rate in older populations, with information or data sufficiently disaggregated for us to be able to determine who had the highest risk of death within the older age group. In emergencies, older people also face discriminatory practices in access to critical services and resources. This can be seen in the design of refugee camps, for example, which often fail to account for important differences in mobility or ability to access collection points for food or other resources. It has also been very visible during the pandemic of COVID-19, where unfortunately there have been many reports of discriminatory practices in access to health services in several countries, especially among those people living in long-term care facilities. For example, in some contexts, resources that were scarce, such as ventilators or access to intensive care units, were allocated according only to chronological age and excluding older populations from access to those resources. Older people are also systematically stereotyped as vulnerable, dependent, and frail, or as passive recipients of care or services, which fails to account for the many contributions that older people make, as well as the diversity. And this can make preparedness, response, and recovery efforts limited or not adequate for older populations. Importantly, this exposure to stereotypes in media, in public discourse, in access to services, in relationships, they can all have very important and negative impacts on older people's health and well-being, as we will see in a minute. Older people also face disparate access to resources, including opportunities for livelihood in emergencies, and are therefore at higher risk of poverty and malnutrition. a 2020 publication by HelpAge International that included close to 9,000 interviews of older people affected by emergencies in 11 different countries, revealed that 77% had no income and 64% did not have enough to eat. I also wanted to mention that it's important to consider that the multiple risk factors and disadvantages that people accumulate over their life course mean that some groups of older people will face heightened challenges in recovering from an emergency. And yet they tend to remain invisible or to receive the same response as other age groups. Again, this is what happens when older people are considered to be a homogeneous group or are stereotyped as a homogeneous group. In the context of emergencies, older people are also neglected in funding allocated for humanitarian response. An analysis from 2016, included also in the Global Report on Ageism, examined humanitarian funding delivered through the UN Consolidated Appeals process, using this as a proxy indicator for the degree to which the specific needs of older people were reflected in humanitarian programming. And what it found was quite alarming. It found that of the 16,221 projects implemented between the years of 2010 and 2014, only 6% included one or more activities that either directly targeted older people or that included older people alongside other vulnerable groups. And only 51% of the projects included in the 6% were funded. So you have a pie chart here on this slide, which I think clearly reflects the inadequate attention in terms of funding allocated for humanitarian responses for older people. I already mentioned earlier that ageism is harmful, but I wanted to look at this in more detail because I think this slide also tells us why we should really care about ageism and addressing it beyond it being prevalent. We know that ageism has far-reaching impacts on all aspects of our health and well-being when we're older. We know that ageism is, for example, associated with earlier death. This was found in 10 different studies that looked at the relationship between ageism and longevity. And what they all found is that people with negative attitudes towards aging had a higher chance of dying over the period of study than those with more positive self-perceptions. Ageism is also associated with poor physical and mental health. In terms of physical health, here we're talking about the presence of chronic conditions, functional impairment, the number of acute medical events and hospitalizations being increased by ageism. In terms of mental health, we see that ageism is associated with the onset of depression, lifetime depression, and increases in depressive symptoms over time. Based on figures for 2015, globally, it is estimated that about 6.3 million cases of depression are attributable to ageism. We also know that ageism accelerates cognitive decline and that it increases the likelihood of us engaging in risky health behaviors like smoking, not taking prescribed medication, or following an unhealthy diet. It further affects our well-being, decreasing our quality of life and increasing the likelihood of social isolation and loneliness. Finally, we see that ageism is not only harmful in itself, but it also exacerbates other forms of disadvantage, including those related to sex, race, and disability. With exposure to these disadvantages being particularly acute in the context of emergencies, which can again further harm those individuals affected by ageism and other forms of disadvantage. The report concludes with 3 recommendations for action based on the evidence that we have. The first one is to invest in 3 evidence-based strategies to address ageism. We also need to improve data and research to gain a better understanding of ageism and how to reduce it. And finally, the report recommends that we build a movement to change the existing negative narrative around age and aging. I will now talk about each of these recommendations in detail. With regards to the first recommendation, investing in evidence-based strategies. Well, thanks to the report, we now know that 3 strategies work in addressing ageism: policy and law, educational activities, and intergenerational interventions. Policy and law can address discrimination and inequality on the basis of age and protect the human rights of everyone, everywhere. What's most important about this strategy is that it can help us address ageism against any age group. Of course, it's not just enough to have a policy or a law as a document. It's incredibly important to have mechanisms in place to ensure the effective implementation and monitoring of those policies and laws, to make sure that they're actually applied in practice. It's equally important for policy and law to be effective in addressing ageism that there is public awareness about the legislation or the policy and clarity on its provisions. And this makes sense. For legislation or policy to have effects in a given community, at least some members of the public need to be aware of its existence. This is needed to ensure that it has an instrumental effect such that the individual aims to avoid the specific penalties in the law, and also for individuals to be aware that they can file complaints if they experience violations of the law. The second strategy that works in addressing ageism is educational activities, which can enhance empathy, dispel misconceptions about aging or different age groups, and also reduce prejudice by providing accurate information or counter-stereotypical examples. Educational activities can be included in all levels of education, so from kindergarten up to higher education and lifelong learning, and they can be included in formal and non-formal education. They are very diverse in terms of the activities that can be included. These can be courses that transmit information, knowledge, and skills about the aging process, for example, as well as activities like role-playing, simulation, and virtual reality. Educational activities are among the most effective strategies for reducing ageism against older people, but we don't know that much about their effectiveness for reducing ageism against younger people. This is one area that warrants further research. And the third strategy that we know is effective in addressing stereotypes and prejudice are intergenerational interventions, which bring together younger and older people and foster this interaction between generations. What they aim to do is, again, to bring together different age groups so that they work on a common task that is of interest to both. These are also very diverse. They can be as diverse as our interests may be. So I may be passionate, for example, about storytelling. So maybe I would engage in an intergenerational intervention that involves storytelling, and where I would share stories and the other person would share their own stories. But they can also include activities like gardening, music, co-housing, and as many as you can probably think of in terms of interests that you may have. These interventions are very effective for reducing ageism against older people, and are also very promising for reducing ageism against younger people. Where possible, the report does recommend investing in these 3 types of strategies in parallel to maximize effectiveness. If we move now to the second recommendation of the report, this dealt with improving data and research. And I think over the course of the presentation, you've already picked up a few areas where there are important gaps in terms of the research that is available. But I wanted to highlight perhaps 3 points in terms of some key gaps that we hope will be addressed in the coming years. The first one, and it's a very important one, kind of the basis for all of the work that we hope will follow, is the importance of using the conceptual framework of ageism that is provided in the report, which is the result of a decades-long process of refinement and consultation among experts in the field. And the reason why it's important to continue with this conceptual framework is that it can facilitate comparability across studies and ensure that everyone working in this area understands the same when they talk about ageism. One of the challenges that we had in producing the report is that sometimes people talked about ageism and referred to different things when using that same term, which, as you can imagine, makes that process of comparability across studies quite challenging. We also need more and better quantitative and qualitative research, particularly in low and middle income countries, where unfortunately there aren't yet that many studies looking at ageism, which of course does not allow us to see the specificities in those contexts. And throughout the report, we do flag chapter by chapter opportunities for research in specific areas. Some examples of areas that warrant further research are included in the slide. For example, more research on the prevalence and the distribution of all forms of ageism against both older and younger people, and including in emergency settings, where unfortunately research yet tends to be even more limited than in other settings, and where we don't yet have as much information with regards to ageism. It's also very important to further study the intersection of ageism with other forms of disadvantage. In the report, we summarize those areas that have some research, which include, for example, the intersection between ageism and sexism, and the intersection between ageism and ableism. But even there is some research, but we believe there's still a lot more to study, even within those intersections that I just mentioned that have been studied, but also with regards to other intersections where we did not find much evidence. And finally, there is this need to further research effective strategies and promising strategies. We need implementation research to help identify the essential components of effective strategies, including in emergency settings, to develop and test new strategies in multi-country trials, and to adapt existing interventions to new contexts, exploring barriers and facilitators of large-scale implementation of strategies to reduce ageism. And finally, with regards to the last recommendation of the report, we need to build a movement to change the narrative around age and aging. This narrative is currently very negative, and it's still accepted as a narrative that we all have and that we're all exposed to on our day-to-day lives. We need to end this stereotypical portrayal of older people in emergencies, which leads to their invisibility or their consideration as passive, vulnerable recipients of services. Unless the humanitarian sector, together with other sectors, ends this narrative, we won't be able to provide adequate preparedness, response, and recovery efforts. Changing this narrative is possible, but it depends on every single one of us. We all have been raised, as I mentioned earlier, in an ageist society, one where ageism is socially accepted and rarely challenged. But it is up to all of us to change the narrative, to question the stereotypes and prejudice that we may hold, and to challenge ageism where we see it. To enable everyone to get started in this process of change and to start taking action, we have put together a living toolkit for the global campaign to combat ageism, which you see on the slide. It contains key messages about ageism, guides for generating conversations with different stakeholder groups, including with your family and friends, a guide to help you organize events, PowerPoint presentations that are similar to the one that I'm using today, and a wide range of communication assets, including social media tiles, infographics, films, Instagram stickers, and many more, which can be used as part of this effort to reach beyond your immediate community, using the campaign hashtag A World for All Ages. To further support the creation of a movement, the global campaign to combat ageism is currently running a sustained theme or initiative on ageism that started on the 1st of October, which was the International Day of Older Persons, and which will end on the 20th of November of this year, which is World Children's Day. The title of the sustained theme is Ageism Through the Ages, and what it aims to do is to give focused attention to ageism as it affects different age groups. During this month and a half, content related to ageism is being released on the platform for the Decade of Healthy Aging and on different social media platforms using this life course lens and giving initial focus to ageism as it affects older people at the beginning of October and moving the focus progressively towards ageism as it affects younger people and children. Valuable initiatives, projects, and expertise about ageism do exist around the world. Each one of those can create ripples of change in their respective context. And our aim with this initiative is to give echo to these efforts so that they are available to the wider community. A series of events on ageism, including this one, are also being offered during this time, which we hope can engage as many people as possible in as many countries as possible. I didn't want to end this presentation without highlighting, which was highlighted also at the beginning of the session today, that the full global report on ageism is now available in Korean. I can't thank the ASEM Global Aging Center enough for their help in translating this report and making it available in Korean so that more people can access it, learn about what ageism is, and hopefully take action so that we can together build a world for all ages. I wanted to thank all of you for your attention today, and I look forward to the discussions and any questions that may come up from the audience. Thank you very much.
Thank you very much for your precise and concise and presentation with summarizing and also emphasis with older persons' emergency situation. Is very vulnerable to the groups that compared to other age groups. And also your last emphasis on changing the narratives. It's really we have to do in everyday lives. Thank you very much for your presentation. And a little bit over the time that we have expected. Anyway, very good presentation. We enjoyed. Thank you very much. Now, next we will have a discussion time, and I would like to introduce three discussants. And we have here one discussion from Korea, and the other two is far away from this place. And the first discussion is Ms. Abu Laf Amal is away from here. And also the Gemma Stobel is also away from here. And Ms. Abu Fresh Amal have some, have a problem in attending this session because of the New York Times, United States, the New York Times is very over the midnight, and she cannot sit at that late on night, and she and her discussions was given by, video. Yes. Could you play the video? Okay.
Good afternoon, everyone.
Okay.
Thank you so much for including me in today's session, and apologies for not joining you live due to the time difference. Hopefully, we will meet in person soon at your event next year or here at the UN headquarters in New York. By now, we heard speakers highlight that as the world's population grows older, large number of older persons will correspondingly be affected by humanitarian crises, especially in developing regions, which is where the pace of population aging is advancing the fastest. But we had a plan. Our team organized an expert group meeting in 2019. Some of those experts are members of your forum. Our session's key speaker, Dr. Vania de la Fuente Nunez, as well as Sylvia Perel-Levine, Matthew Wells, Professor Supriya Akarkar, and Dr. Sari Timur. The plan was to generate recommendations on older persons in emergency situations, present that in the UN Secretary General's report, to promote and advocate this issue amongst the delegates negotiating the Annual General Assembly Resolution on Aging in New York. The experts were clear. Older persons are not a homogeneous group, and many are at risk in emergencies, and their specific circumstances and needs are not always fully recognized and considered at all phases of humanitarian action. Older persons may require targeted actions to incorporate their needs and circumstances into humanitarian response. Research shows that between 2010 and 2014, less than 1% of implemented humanitarian projects included any activity targeted at older persons. There's often a lack of necessary skills among first and second responders and volunteers to understand, identify, and address the specific needs of older persons. And as we will likely hear from our colleague Gemma at HelpAge International, older persons report significant barriers in gaining access to humanitarian assistance. This marginalization in humanitarian action is often aggravated by a limited understanding by donors of how programs and projects affect older persons, which translates into a lack of explicit requirements on addressing the needs and situation of older persons in the programs and projects that they fund. All of this exacerbates the likelihood of exposing older persons to protection risks, which render them more vulnerable to and disproportionately affected by emergency crises. Experts noted that stereotyping, prejudice, and discrimination against older people on the basis of their age is often exacerbated during a crisis. You can see some examples on the slide. This can result in a lack of focus on the specific needs of older persons and/or committed resources to relevant policies and actions. All these assumptions permeate the humanitarian system and result in a biased response that is neither age-sensitive nor inclusive of older persons or their capacities, contributions, and frequently their standing in the community. It is important to underline the roles that older persons, in particular older women, play during emergencies. You can see some of the many examples on the slide. The knowledge and skills of older persons can be invaluable. Such new roles should be recognized by humanitarian actors and donors so that older persons and their families receive appropriate, tailored support. However, to bring visibility, voice, and inclusion to older persons and fully understand and address these needs, as well as recognize their contributions, there is a need for consistent collection, processing, dissemination, analysis, and use of data disaggregated by age, including older age, sex, and disability in all phases of humanitarian crises. Later that year, and based on the findings of the expert group meeting, the Secretary General submitted a report to the 74th session of the General Assembly, highlighting key issues and existing normative frameworks, as well as challenges and opportunities in responding to the rights and needs of older persons in emergency crises. The report also includes 5 key recommendations for consideration by the Assembly, which you can find in the link that we've placed on the slide to the report. When we set this plan in motion, we observed the invisibility of older persons in humanitarian resolutions of the General Assembly, where older persons are only mentioned along the other vulnerable groups and have never had a dedicated specific paragraph, as is the case for other groups. Also, at the same time, the ECOSOC had addressed older persons with a specific paragraph, but it was a general paragraph in the preamble, which does not provide guidance to countries on how to mainstream older persons in emergencies. Now the research and findings were in the hands of New York delegates, and following a fierce debate, member states adopted a resolution with additions to the operational paragraph on older persons in emergency situations. This is the text highlighted in blue on the slide, where they utilized 3 out of 5 of the recommendations by the Secretary General. As you can see, this is a stepping stone in an uphill battle that requires all hands on deck. I thank you for your attention. And from all of us here at the DESA Program on Aging in New York, we wish you all the best in your deliberations.
Okay, she presented by a videotape, and because she couldn't participate in discussions, and because of the time, is the differences. You may understand what the situation is this. Also, we have another presenter and from Korea, and I'd like to let me introduce, I forgot to introduce that first discussant. Ms. Abu Rafa Amar is the Chief Program of Aging Unit at United Nations Department of Economic and Social Affairs. She is originally from Saudi Arabia, and she has joined the United Nations since 201, and worked in the area of the social policy, sustainable development, and demography. And she also served on the Secretariat of the General Assembly's open-ended working group on aging, and is a member of the steering committee of the Teachfield City Group on age-related statistics and age disaggregated data. Okay, I'm sorry that I forgot to introduce yourself before your discussion. Okay, next is Dr. Sundar Chung. I would like to introduce briefly her. Dr. Chung is a professor at the Department of Social Welfare at Ewha Women's University in Korea. And she is an expert in the field of gerontological social work and case management, and depression, and baby boomers, and retirement preparations, and age integration. She served as an editor of Journal of Korean Gerontology, associate president of Korea Gerontological Society, and professional reviewer for several professional journals in gerontology and social sciences. She has an extensive published papers in domestic and international journal of gerontology. Dr. Chung, would you please have your discussion?
Good afternoon, everybody. I'm Sundar Chung, professor of Ewha Women's University. First of all, I'm very pleased to participate as a discussant in 2021 ASEM Forum on the Human Rights of Older Persons. I think today's discussion is very important because we discuss about the ageism and ageism in disastrous situations such as COVID-19. In March 2021, a global report on ageism was published by the WHO, outlining the nature of ageism, evidence-based practice issues on ageism, the impact of ageism, determinants of ageism on older persons and countermeasures to overcome ageism. Because ageism, which is based on discrimination against older adults, is closely associated with their physical and mental health. It is considered to be a serious problem that deteriorates the quality of life in older adults, and furthermore, disturb active aging. The report is meaningful in that it suggested various ways to deal with ageism in light of addressing such issues. I heard that ASEM Global Aging Center translated this report into Korean, and I hope that today's publication of the translated version of the report will serve as a strong foundation in resolving the problem of ageism. I would like to proceed with today's discussion from 4 aspects. First, why we should focus on ageism again. Second, how is ageism in Korean society? Third, the importance of EBP, evidence-based practice, for ageism. Fourth, the strategies to combat ageism. 3 and 4th discussion topic, I would like to add some perspectives to the global report on ageism of WHO. The first topic is on why we should focus on ageism. Ageism is associated with longer lifespan due to aging, as we are predicted to live to the age of 100 compared to life expectancy of 60 in the past. We have to spend more than 30 years as an older person. The life expectancy of Korean, now 83.3 years, has increased by 3.3 years in 10 years, which is higher than the average of OECD countries is 81 years. However, older adults who were once highly respected under the Confucian value in Korea are no longer considered to be productive anymore. Our society's practice of judging people for their productivity has turned into the older population into the images of helplessness and incompetence. Due to this, the role of older adults has been disappeared. In addition, the older population is classified as a vulnerable group in the unprecedented crisis situation of COVID-19, as they are known to have a high risk for infection and high mortality rate. In order to protect and ensure safety of older adults, some discussions policies on isolating and containing the older population. Protecting older adults from infection is an important issue, but it can be also seen as a violation of human rights that does not respect their opinion. Furthermore, defining older adults as a vulnerable population without considering their individual characteristics or environment does not only threaten their survival, but also reinforce negative perceptions on older population, and consequently impede social integration. Therefore, such discussion itself can carry the risk of discriminating the older population. Second topic examines ageism in Korean society. Ageism, discriminating someone based on their age, is one of the 3 types of discrimination along with sexism and racism. However, what separates ageism from the other 2 is that everyone is prone to experiencing ageism because everyone becomes old at one point in their life. According to the 2020 human rights statistics in Korea, age discrimination was appeared to be the second largest after economic discrimination. In addition, according to the survey result of a National Human Rights Commission 2018, it was reported that 21% of older adults have experienced discrimination at least once. Next, discrimination in labor market occupies the highest rate among the areas of discrimination against the older population. In a survey of values and perceptions on demographic change, family, age, and generation, majority of respondents agreed on the question, old age is too old to start a new job or learn skills and knowledge. And 87.6% agreed on the question. It is difficult for older adults to find a suitable job where they can demonstrate their abilities, indicating that older adults are perceived as unproductive, and it can be seen they are being discriminated against in labor market. Next, many things have taken place in our daily life after COVID-19. For instance, dependence on digital device has increased. As we obtain information on COVID-19 through our computers and smartphones. However, only 51.7% of older adults use computer, tablet PC, and smartphones compared to 70% of them utilizing TV and radio. And there was a little change in the time and frequency of uses among older adults. The information gap between older adults and younger people, expressed as a digital divide, is pointed out to be a bigger problem amidst COVID-19. And it is becoming a new form of discrimination against the older adult. For example, increased case of hate speech against the older adults are observed on websites where users can remain anonymous. One interesting news article pointed out that how AI is not good at recognizing expressions of hatred and filtering them. In a situation where information on COVID-19 is transmitted through digital devices, and where non-face-to-face and online activities are increasing, older adults who have low levels of information are put at risk for social exclusion and a threat for their life. Therefore, policy support to overcome the digital divide should be provided, and face-to-face activities should be maintained in consideration of older adults, even in the era of a non-face-to-face contact society. Third issues, evidence-based practice research is required to help understand the ageism. Here, two issues can be raised. One is the scale for measuring ageism, and the other is the mechanism for identifying ageism. First, the WHO report raised the question regarding the scale for measuring ageism. Because most of the scales that measure ageism are based on subjective perceptions, there are difficulties in measuring direct discriminatory behavior. In the ageism scale, it is important to understand not only the perception of older adults, but also the behavior dimension in terms of discrimination. However, most of ageism scales are constituted of factors such as bias, stereotypes, and negative attitude. In addition, because the behavior element mainly contain verbal expressions of a hostile tone, verbal expressions, and verbal violence and avoidance of contact, the indicators for discriminatory behavior are not sufficiently reflective of other behaviors other than verbal contents. Therefore, it is necessary to develop a scale that covers all of the dimensions of perception, emotion, and behavior of ageism. Next, I'd like to talk about the mechanism of ageism. The relationship between terms related to ageism, such as discrimination, stigma, stereotype, prejudice, and exclusion, along with the mechanism for ageism, should be clarified. Age discrimination refers to a combination of negative attitude based on prejudice against older adults and aging. And there exist perspectives that regard discrimination as an attribute of a stigma or as a result of a stigma. In addition, as many older adults stay in simple, temporary, and low-wage jobs due to prevalent ageism in the labor market, such discrimination along with retirement policies can lead to social exclusion of older adults from the society. Concepts of prejudice, stereotypes, discrimination, stigma, and exclusion are related to negative perceptions and are often used interchangeably in studies. However, there are very few studies that examine the mechanism of relationships among those concepts. In the research of Jung and Park, actually, I conducted this research. Knowledge attitude behavior model, I used this model to explain the causal relationship between knowledge, attitude, and discriminatory behavior toward old adults. The result of this study shows how knowledge on older adults acted as a factor in shaping attitude toward older adults, leading to ageism and discriminatory behavior. Therefore, it is necessary to investigate the mechanism leading to ageism in consideration of each concept to prevent and reduce discrimination against older adults. Let's move on to the final part, fourth. Fourth is regarding the strategies in combating ageism. I will examine 4 ways to do so. First, the strategy is related to on age-sensitive policy. I would like to suggest mainstreaming aging as one of the strategies to combat ageism. All age groups make equally important contributions to society and to their communities and families. Older persons can make their knowledge and experience available to the society to ensure that they can remain active and independent for as long as possible. Policies supporting their social and economic integration in all spheres of society are necessary. To achieve this complex goal, a holistic approach whereby aging is integrated in all policy fields is needed. Therefore, mainstreaming aging is a strategy, process, and multidimensional effort of integrating aging issues into all policy fields and all policy levels. Successful mainstreaming means including all relevant stakeholders in decision-making to ensure that the needs of all age groups are met in all policy fields. Mainstreaming can be seen as an important tool for achieving a society for ages. Second strategy is the need for education on ageism from childhood. As the social and cultural gap experienced by different generations of the society become wider in a rapidly changing society, the opportunities to communicate with other generations are decreasing. Under these circumstances, it is not surprising to see younger generations to have difficulties in understanding the views and behaviors of older generations. Therefore, education is needed to give deeper understanding of older generation to younger generation, and to provide with more knowledge regarding old age in the course of lifespan. Such education should be included in the regular curriculum in school, and diverse programs that allow direct interaction with the older generation should be provided. Also, as in the WHO report, they present how the experiences during childhood continue to affect them later throughout life. A result of a survey also reported that a 3-year-old child was already aware of ageism. Therefore, it would be better to start the education from an early age. It was discussed already at the presenter of this session. A third strategy is to utilize awareness improvement using media, especially the use of discrimination awareness campaigns such as public service advertisements in Korea. Recently, various forms of media play a major role in our daily life, regardless of our age, and they are affecting the formation of social awareness, consciously and unconsciously. Because older adults are often portrayed as passive and dependent beings in the media, efforts are needed to improve the perception of older adults by showing more positive and active images of them through the media. In particular, concise and visual elements should be considered when comparing positive images of older adults for younger generation, rather than having standardized advertisement format or lengthy content. Korean public service advertisement, which are advertisements produced for public interest, can come into play here. For instance, image of one person, both as a young person and an older person, can be overlapped to improve the perception of older adults, and it is shown in the form of both male and female. Such advertisement would provide the message that everyone can age and that no one should be discriminated, which could be the future of myself. Efforts should be made to improve awareness through this method. Last thing, empowerment of older adults is needed to actively respond to discrimination. Older adults often do not recognize discrimination by themselves, and those who do experience discrimination often give up and respond passively to such situations. Therefore, it is necessary to strengthen the capabilities of older adults so that they are able to express their opinions actively with confidence to the discrimination they are experiencing. In addition, increased social roles of older adults through active social participation, such as jobs and social contribution activities, will help to improve the independence and empowerment of older adults. Yeah, that's all. Thank you.
Yeah, thank you very much for Dr. Chung. We have another discussant from Australia. I know that she is in Sydney. Are you in Sydney, right? Dr. Gemma Strobel, and I would like to introduce briefly Dr. Gemma Strobel. And Dr. Gemma Strobel is Global Voice Advisor, HelpAge International. Dr. Strobel is from Australia and holds a doctoral degree in international relations and international development. She started her career working for Amnesty International in Australia. She moved to UK and has worked at the international HelpAge International since 2014. And she has been leading the organization's ageism work for the past 4 years. She has been responsible for ageism capacity building initiatives and has delivered training for various NGOs in many countries. Okay, you have waited a little bit more time, and could you please do your discussion? Yeah.
Good afternoon, and thank you very much to the organisers of this really important event and the opportunity to be a discussant in this session. And thank you to Vanya for your presentation. And although I've read the report and attended a number of webinars and findings, no matter how many presentations I've attended
I still find it enlightening and that there are new things that jump out at me every time. And this time it was the information about the percentage of older people impacted in emergencies and how we really must do more to tackle ageism in all settings. Ageism is a human rights issue that we know often remains invisible. It feels like ageism is starting to be more understood and is starting to be something that is challenged. But I know that when I talk to my friends and family about ageism, it is still something that is not taken as seriously as other forms of discrimination. Ageism is so pervasive in our societies that it largely goes unrecognised. As one of the speakers shared yesterday, I think it's important to recognise that while the COVID-19 pandemic in many contexts has exposed ageism, the pandemic has done just that, exposed what has already been there. Age-based measures to restrict older people's movement have been a common response at every stage of the pandemic. They have been implemented in countries around the world in the initial stages of lockdown and as countries have come out of them. They include preventing older people of a certain age, for example, those over 65 or 70 years old, to leave their homes or to go back to work. They've prevented older people from visiting shopping malls and restaurants or participating in religious activities or using public transport. At the early stages of the COVID-19 pandemic, we reached out to our network members with a survey, asking them about what older people's experiences were during the pandemic. Respondents reported that older people's needs are a low priority in many places, including amongst politicians and policymakers. One person said that older people are culturally and politically disregarded and excluded. Many also reported that stereotyping and discrimination against older people, as well as a solidifying of ageist attitudes. This was said to be related to older people being at heightened risk of serious illness and death from COVID-19, but also the miscommunication or misunderstanding that the virus is therefore only a threat to older age groups. As a result, older people were reported to be seen as a homogenous group. As countries have rolled out the vaccination programs, older people have been prioritised on paper, but they have experienced barriers in their right to vaccinations. In some countries, programs have been rolled out digitally and older people have been excluded. For me, the global report on ageism launched earlier this year, it really arrived at a time that we needed it. At the end of a year when COVID-19 had a devastating toll on the lives of many older people, the report helped to expose ageism and helped to show the nature, scale, impact, and determinants of the problem. In providing an overview of the nature of ageism, the report highlights a growing number of studies that have explored the interactions and intersections between the different isms, and this was something that Vanya highlighted in her presentation. The two forms of intersections that have been explored in more detail is ageism and ableism, and ageism and sexism. I was pleased to see the report referencing gendered ageism and using witchcraft as an example of the ways that ageism and sexism can manifest. Importantly, one of the suggested areas for future research is how ageism intersects with other isms. In some cases, we need research to understand more about the problem, and in other areas, we need action. For example, the report reveals how accusations of witchcraft and discrimination directed at older widows is one manifestation of ageism. Just last week, 4 older women were killed in Kenya, in Kisii County, on accusations of witchcraft. HelpAge, along with the Kenyan Human Rights Commission and a number of other organisations in consortium, have worked to mobilise the media for a press conference and will continue sustained advocacy on this issue. Ageism doesn't operate in a vacuum. We need to understand how different cultural practices may help to sustain ageism, like witchcraft allegations, and how age stereotypes differ in context and culture. As an organisation that works in low and middle income countries, this is crucial
and the recommendations in the report to fill research gaps is greatly needed. This will help us to know more about the impact of ageism in the countries that we work, and to understand how ageism may vary across individual characteristics. The strategies that the report lay out are really useful for us as a civil society organisation, and I'm sure for others. The strategy on educational interventions shows us that some of the activities that we've been engaging in are evidence-based. For example, our network members in a number of countries engage universities to provide information to students about the rights of older people and the work that they do at the national level. Implementing intergenerational activities is something that we've incorporated into our programming for a number of years, although we haven't been sort of collecting evidence about some of the impacts of that. And so knowing that these activities help to reduce ageism means that we will try to ensure that these kinds of activities continue to be built in more systematically. We hope to build more intergenerational partnerships, and we hope to incorporate both educational and intergenerational activities because, as Vanya mentioned, this helps the effectiveness. Overall, I found the report hopeful and reassuring to know that we can all do something about ageism. The final chapter highlights what specific stakeholder groups can do, providing us with clear actions that we can take forward as academic institutions, governments, United Nations agencies, civil society, and the private sector. After a year that has been so devastating on the lives of many older people, it was encouraging to see the launch of the Global Report, as well as a new report on ageism and age discrimination published by the UN independent expert on the rights of older people, and also a recent substantive resolution passed at the 48th session of the Human Rights Council focused on ageism and age discrimination. It feels like there is momentum, but what we really need and what HelpAge continues to advocate for is a new convention. And we were really pleased to see that this was also recognised in the Global Report, where it stated that international policy and legislative guarantees against age discrimination should be increased, and that an international convention could turn aspirations into a binding obligation. This would mean that we would have a framework that would guide older people's human rights. The Global Report has put the spotlight on ageism in such a way that it seems like it cannot be ignored. Thank you to my colleagues at the World Health Organization and the other UN agencies in bringing this report to us. I believe that it will help all of us to address ageism and create a more equal world for all of us as we age in emergency and other settings. Thank you very much.
Thank you very much, Dr. Jim Strobel. And we have a presentation and discussions of 3 persons. And we are a little bit getting later, but we still have about 25 minutes is left. I would like to give an opportunity to the Dr. Fuente Nunes of any response to the discussion, what they say, and then we come back to the discussions among our participants and presenters and discussions. All right, would you please, you have any comment of the answer or something like to what you want to talk about?
Yes, sorry, thank you very much for giving me the floor now. I was listening and really welcomed all the contributions of Amal Abu Rafu from UNDESA, from my colleague in Korea, providing a very concrete context of what is happening also at country level. And I've been actually taking notes about some of the experiences that you were mentioning, and how, for example, the reflection that you were having, which I think affects other contexts in terms of the value that is given to productivity and how that affects how older people are valued. And I was just in recent discussions earlier this week and last week, and this came up as a common theme affecting older people, but also younger people before they enter the workforce. So it's interesting to also see these commonalities across countries. Same with the comments that you were making about the stereotypes of, the common stereotype of incompetence and friendliness for older people that you say is reflected in Korea, which I think is also reflected in many other countries based on the research that we have. And it's interesting to see the commonalities, but also see the differences that I think Gemma was speaking about in terms of that research that is needed in those areas where we unfortunately don't know that much, and because we don't know that much, we don't know the specificities and how people do experience ageism in those contexts. I also really welcome those contributions around the digital divide and how that has particularly affected older people in the context of the pandemic, where we have made a major shift to the use of technology, and where older people who don't have access to technology, or who do have access to it but do not use it frequently, maybe because they've internalized stereotypes or because they're not provided with that access, how that affects then their ability to continue to enjoy things that they were doing before and that suddenly they can't do. On that aspect, and we speak about it in the report, but not in depth, because there's still not a lot of research. But the digital divide also, I mean, ageism is also present in technology in terms of how technologies are designed, and also the fact that there's this common stereotype that older people are technophobic or disinterested, or they just don't want to update technology, which we then see is not necessarily the case once they're given the chance to use it. But this is one of those areas where it's important to learn more about what are those barriers and how is ageism contributing to the persistence of that digital divide moving forward. And Gemma, I thank you again for highlighting the importance of looking at intersections and gendered ageism. I think gendered ageism and those accusations of witchcraft that you were saying, and I was not aware of the recent reports that you were mentioning in Kenya. I mean, this is a terrible manifestation of ageism in very concrete context, and I think it's important that these are brought into light so that people do not see ageism, as we were mentioning earlier, as just something that relates to maybe older people being stereotyped and that does not have severe effects, I mean, in this case, on the direct life of 4 women in those countries. I think experiences like this and stories like this can again continue to increase awareness about the importance of addressing ageism now, and not continue to wait and continue to accept ageism as something that is just there and will continue to be there. As I was mentioning earlier, we all have a role to play in challenging it. And finally, I really welcome the contributions of Amal in terms of how specifically ageism is present in emergencies, based on that first expert meeting that took place a few years ago in New York, and how that has led into some form of progress, but we need a lot more action so that older people stop being neglected in emergencies. But I mean, I think we've heard enough today that emergencies is just one setting. It tends to be in every setting, and emergencies, because of the heightened vulnerability of that context, are a place where it's even more present, if anything. So thank you for the 3 of you for the wonderful contributions, and I hope that we have some time to get questions from the audience.
Okay, thank you very much for your good response to the discussion. I would like to have a time for any thing that for discussion can add, or to talk about more about what you want to do, to tell us and discuss, and what you have not have done for enoughly, and you can have a time to talk about a little bit more about the discussion. And anybody, any discussions, and 2 discussions we can participate here for discussion, and Dr. Chung and Dr. Stovall, and you can have time to talk about a little bit more. And then we come back to general discussion and pre-discussions among our participants. No? Anything? That you have anything? No? Okay. Dr. Stover, you don't have any? Okay. You don't have any more thing to talk about. Okay. Any question or comment on the speaker and discussion on these topics of this both sessions? And here we get an answer from the participant here. All right. Yeah, one participant raised a question about the measurement of the ageism, and how can you, maybe Dr. Nunez, I think you can answer this question. How can you measure that ageism is more prevalent in mid and low-income countries? When you say that there is a lack of data apart from Europe. And yes, I was questions about that, about you know, the judgment, and you know, the measurement scale is not is completed, and so the WHO is going to develop a global scale of the ageism and to measure more precisely the ageism all over the world. But what is the basis of your judgment of the ageism is more prevalent in mid and low-income countries? And the,
yes, thank you.
Yeah.
Thank you very much for that question. I guess I should have clarified. So we do have data on prevalence of ageism against older people from many countries in the world, including low and lower middle income countries. What we are lacking, or where we see less data, is when we look at, for example, the manifestation of ageism in specific institutions, or, for example, the impact of ageism in different countries. And most of the evidence that we have in those two areas comes from higher income, upper middle income and high income countries. So these are two areas where we hope to have more research done in the coming years. It's important to see, for example, how ageism manifests in employment in low and lower middle income countries, where, for example, we see a higher presence of older people in the informal sector. So those types of information and that type of evidence we don't yet have as much of as we have from other settings. Same when we're looking at the impact of ageism, for example, on health. We would like to see more studies exploring the impact of ageism on health in low and lower middle income countries. Or, for example, more studies looking at the implementation of the strategies that I mentioned that work in addressing ageism in different settings. We need to make sure that we take into account potential barriers or facilitators that can help us implement those strategies across settings. It's not the same to implement a strategy in a high income setting as in a low income setting. So the more evidence that we have, the better, in the sense that it will allow us to better implement and design those strategies that are adapted to those different contexts. I also forgot to make a reflection on the comment that was made earlier about the scale of ageism. It's true that in the process of developing the report, we conducted a systematic review, which basically looked systematically through all of the evidence that exists on existing scales to measure ageism. And what we found was not very hopeful, in the sense that we found that available scales to measure ageism are either of inadequate scope, so they don't necessarily measure the 3 dimensions of ageism that I mentioned. So they don't measure stereotypes, prejudice, and discrimination, but maybe just focus on 1 or 2 dimensions. Or what's perhaps worse is that they're not of adequate validity. So they fail to adequately measure ageism. So what we're doing now, and we're in the process of doing this, is to develop a new scale of ageism that we hope can help us accurately measure ageism across countries in the coming years. This will be important for a number of reasons. First, we want to make sure that we have accurate information about the prevalence of ageism against all age groups across countries. We also want to learn about whether ageism is being reduced in countries that are going ahead and implementing the strategies that we know work. So again, we're currently in the process of developing this scale. This will be a longer-term project because it requires multi-country testing. But we're already, it's already been started as a process, and we're hoping to make it available in the coming years. Thank you.
Okay, okay, thank you for the. I like the report that WHO has very extensively reviewed the existing studies and scientific data existing, and I think the most comprehensive review is reflected on WHO's report of the ageism, but as the report pointed out, that the measurement scale is not really, with a good validity and reliability. So I am very much glad to hear that WHO is going to develop, and with their collaborator, to a very globally applicable measurement scale of the ageism. And then we can measure more precisely what the ageism is, and we can compare between countries, between culture, and I think that will be a great job in the near future. I think it is important. In relation to this, I have a question about that. When do you expect that complete development of a new global scale?
Yes, so as I was just mentioning, so we kicked off the process last year, but it's a 4 to 5 year project. Because it requires if you want to do it correctly in terms of validating the scale, it requires many different phases of refinement, and then multi-country testing, translation, making sure that the translations work. So it's a long project, but it's one that's much needed, as I was mentioning, because otherwise we won't be able to accurately see where we're going in terms of this area of work, and whether our actions are having the effect that we hope.
Okay. As far as I know, that the Global Aging Center here, the organization is organizing this international forum on right of the older person, have tried to develop a ageism scales to be applied to an Asian and the European country, but we have not really succeeded. But I think this is important. And I think this is a very important thing, that why you think that is the cultural perspective. And we have to really consider the cultural dimension about the ageism. And, in every people here, is the cultural variation is very important in judgment of what is the ageism, what is not the ageism. This is important. I think I would like to tell you about that. You may also know that the importance of the cultural dimensions of the defining on the measurement of the ageism here. Okay, and any other question and comment related to presentation? And Dr. Stover, you have raised the hand? No?
There's no digital hands to raise, so I thought I would raise a physical hand.
Mm-hmm.
I think that point about culture is really interesting, and I just wanted to share a reflection from conversations that I had recently, and then a number of years ago. But when we started talking about ageism, and I was talking to colleagues in different countries in Asia and different countries in Africa, and something that was really interesting that was coming back to me was I was being told that ageism doesn't happen in my country. Ageism doesn't happen in Kenya. Ageism doesn't happen, in Cambodia. We take care of our older people. Our families take care of older people. So I think it really, we were talking about settings. I think ageism in the family is something that would be an interesting thing to look at. And I think, we're family members, we all care for our older relatives, and something happens where we think that we know best, and we should make decisions on behalf of someone else. And I think in terms of, sort of that interpersonal ageism that happens, it's very interesting. And then just something else in terms of, we did a qualitative pilot research project a few years ago, and I think something that is incredibly important is that and which was also in the global report, but is just the fact that we keep on asking older people about their experiences of ageism, as well as younger people. But I think there are so many things and so many sort of intersections that we should be looking at that maybe we're not aware of now. But if we keep on talking to older people, as time goes on, new things are going to be popping up. So thinking about ageism and digital exclusion, but just that piece about really needing to listen to older people and hearing from older people themselves in terms of that lived experience, I think is incredibly important.
Okay, thank you. Very good comment on that point. Any other question and comment to the speakers and discussions? We have almost approaching to the end of this session, and if you don't have any more question and comment, and I would like okay, you can, okay.
It's a bit difficult because it seems like the screen is behind you, so you don't see whether we have our hands up or not. No, I just before we close, I guess I wanted to remind everyone that we have the initiative Ageism Through the Ages running at the moment. So if any of the attendees or anyone who listens to this video afterwards has any contributions, any resources to share, or even your voice, if you want to share any experiences that you've had of ageism, we really welcome all contributions on the platform for the Decade of Healthy Aging. We will become, as a movement, as rich as the contributions that we have. So we really hope that you can all contribute and look forward to receiving those contributions. I don't think I can provide the link to it here, but hopefully that can be made available by the organizers of the conference at a later stage.
Thank you very much. Okay, now we are going to closing this session, and now I'm going to thank you for the presenter and speaker and discussant, and for your good effort for this session. And I would like to thank you for those people from Korea and overseas, and to stay with this moment here in this session. And I would like to urge all the participants and particularly, I want to talk about one comment about, the ageism. There are many ways of many policy and many ways of, combating ageism here. So I would like to urge all social leaders, including some people here and those who are listening what I'm saying, and in public and private sectors of the society, many of whom are age 60 and over, and to take the lead in combating against ageism. And usually these leaders in public or private sectors tend to be not so sensitive to the ageism, even though they are of old age. They usually believe the fact that chronological age does not match the biological age. However, they usually deny the fact that in the case of others of their same age, they are not, believing that chronological age is equal to the biological age, but to other person, they apply that kind of logic. This is a very important thing. So I'd like to urge all the social and the political and cultural and educational leaders who are already of old age to be more sensitive about the ageism, not to themselves, for them other people, for the common good of our society. Thank you very much. And I hope all the participants of this session and to be a leading soldier combating against ageism. Thank you very much. And goodbye, everybody. Thank you.
Yes, thank you very much. And Officer Puente Nuez will make sure that we have the link and ready for the others to have a look. So thank you very much, the Officer Puente Nuez, Chief Rafe, Dr. Chong, and also Advisor Stovell, and also Dr. Choi for leading out the session. Thank you very much, all the panelists. You may now head down the stairs. Thank you very much. Yes, ladies and gentlemen, you have been here with us during the 2 days. We had 4 sessions and 1 special session. Well, as of the COVID-19, the inconvenience that the older persons face increased even more. So in order to protect and promote the human right of the older persons, the ASEM Global Aging Center organized its first forum on the human rights of the older persons. We have dealt diverse issues during the last 2 days, and I could not think of any other way in order to end the forum. It is my honor to invite to the stage Dr. Lee Hae-kyung, the chairperson of ASEM Global Aging Center, for the closing remarks. Ladies and gentlemen, welcome her with a big round of applause.
Ladies and gentlemen, distinguished guests and friends, it is now the time to bring an end to the first ASEM Forum on Human Rights of Older Persons, Present and Future, under the topic of protection of the human rights of older persons in emergency situations. First of all, I would like to extend my deepest gratitude to all the participants, presenters, discussants, moderators, and guests both online and offline. I do appreciate for your tremendous contributions to make this forum a great success. I also would like to thank the AGAC, ASEM Global Aging Center, for your inspiring efforts to make this important forum not only possible, but also so wonderful. My appreciation is also to be extended to our co-organizer, the National Human Rights Commission of Korea, as well as our great friend, the EU Embassy to Korea. I think it is very meaningful and very opportune that we are holding this forum only in some 8 months after the 20th informal ASEM seminar on human rights under the topic of human rights of older persons, which was held in last February, right at the same convention hall. I think it marked the very first and very timely endeavor, taking the topic of human rights of older persons in highly reputable history of informal ASEM human rights seminar. It was the first and invaluable opportunity to connect hundreds of world-leading experts on aging for the community of ASEM partners. And there, we have fully concurred that the needs are urgent more than ever for domestic, regional, and international actions to promote and protect human rights of older persons to improve their living conditions. As we all know, the COVID-19 is not an equal virus. Its impact is wide and universal, but it's utterly unequal. It has and will have the greatest impact on those already experiencing poverty, poor health, exclusion, and discrimination, revealing and exacerbating the existing inequities which had been much widened and deepened during the last 40 years of globalizing neoliberal economic world order. As has been emphasized and evidenced again and again throughout this forum, older persons are the group affected largest in number and hit hardest in severity, but considered the least and the last. It is nothing but a consequence and the reflection of their weak social, economic, and legal positions in their societies. During last 2 days, we have held 4 sessions to deal with the themes of health crisis, humanitarian crisis, climate change and natural disasters, and ageism. In these sessions, we have learned how the rights of older persons have either been neglected or only inadequately addressed in the currently existing prevention, management, and response mechanisms in these different emergency situations. Participants of the forum had a valuable time to diagnose the status quo and explore the various ways to move forward in various environments. One of the notable aspects of the forum was that it was joined by 2 members of the World Health Organization. Dr. Mike Ryan, the Executive Director of Health Emergency Program, delivered a wonderful keynote speech to us, and Dr. Vania de la Nunes presented on the key findings of WHO's global report on ageism, showing how important the implications of ageism for the health and human rights of older persons. And also, it made us more aware of how ageism manifests itself in emergency situations and how emergency situations in turn augment and exaggerate the existing forms of ageism. And I'm happy to announce that this important report of the WHO has been translated into Korean in full by the ASEM Global Aging Center recently. And it has been, this translated version, the Korean version, has been uploaded on the WHO's homepage. Applause. And in addition, what made the forum particularly special is that it hosted a special session named Civil Society Talk Concert, where 6 representatives of influential international civil society groups working on the rights of older persons formed an excellent panel and shared their experiences and views gained from their long engagement in the issue on the ground. And most of all, the significance of the civil society talk concept lies in the fact that it has alerted us to the voices of older persons that have often been neglected in drafting policies that are designed to serve the interests of older persons, particularly in the context of emergencies. Last but not least, in parallel to the forum, an online exhibition of global campaigns for the human rights of older persons was also organized. The exhibition displayed the works of campaigners from international organizations, civil society groups, governments, and the private sectors, as well as individuals from around the world. The campaigners in the exhibition addressed various issues relating to the human rights of older persons, from ageism, the UN Convention on the Rights of Older Persons, women in old age, workplace age discrimination, and the well-being of older persons, to changes in the narrative around age and aging. I believe this exhibition effectively disseminates to a larger number of global audiences the key messages of grassroots movement to protect and promote the rights of older persons. Through in-depth discussions of the 4 sub-themes of the overarching theme of human rights of older persons in emergency situations, the civil society talk concert, and the online exhibition of global campaigners for the human rights of older persons, this forum has again confirmed the human rights. This forum again confirmed the validity of a human rights-based approach to protect older persons from any forms of discrimination and abuse. The human rights-based approach sheds light on the fact that the extended longevity of people today is something to be celebrated as one of the great achievements of mankind, rather than to be worried about as a burden on society. The human rights-based approach understands older persons are the agents of their lives and choices, and their access to health service, decent living, and social protection as part and parcel of their enjoyment of human rights, rather than seeing them as passive recipients of benefits and welfare. This principle should be adhered to not only in normal times, but in every situation and context, including in emergency situations. The human rights-based approach, therefore, demands a radical change in our mode of thinking and doing with aging. After all, the COVID-19 pandemic is a very loud wake-up call to the gaps and violations of human rights of older persons who are equally entitled to the enjoyment of their civil, political, economic, social, and cultural rights as listed in the major international human rights treaties. As the Executive Director Ji Eun-hee mentioned in her welcoming address yesterday, now is indeed the time for a radical transition of the points of views, modes of thinking and doing about aging and human rights of older persons. And also, as Help Age International exclaims, if not now, then when? I am very pleased that the first ASEM Forum on the human rights of older persons, present and future, has made an important contribution to this end. Having seen a growing interest and concern about the rights of older persons, particularly after the COVID-19 pandemic, I am very hopeful to see that an increasing number of the academics, researchers, national policy makers, and civil society groups recognize the importance of a human rights-based approach to aging and actively disseminate this idea. In this context, I'm also confident that the role of the ASEM Global Aging Center will become even more important in the ways to come in helping to promote this agenda by bringing various actors from ASEM partner countries together to this common goal. Once again, I thank very much the organizers of this wonderful event and all participants for their candid, enthusiastic, and deeply engaged discussions. I truly hope and believe that the forum will add to the global endeavor to make global society more equitable and freer from discrimination for all. Thank you very much for your attention.
Thank you very much, Chairperson, for closing the forum with your remarks. Well, ASEM Forum on Human Rights of Older Persons will continue to strive to serve as a valuable platform protecting and promoting the human rights of the older people. So in that sense, we'll be looking forward to your continued interest and support towards the ASEM Global Aging Center in order to lead the way. Once again, from the bottom of my heart, thank you everyone from all around the world for tuning our forum. And with this, we end the ASEM Forum on Human Rights of Older Person, Present and Future. I was your MC Shin Ji-ye, and until next time, goodbye.